Sandra all the time is here with a cold heart true. She's the ears and the eyes for me and you. Every day, everyone want to hear from Sandra. And every time on the air, she's getting better. Tell your sister, tell your brother, tell your mama, call Sandra in the morning and in the evening. They always calling Sandra. And when they start fighting, they calling Sandra.
That's right, folks. Everyone is telling their mama about the cold hard truth. Welcome to another episode with more truth-telling, more problem-solving, and of course, more tea spilling than ever before. Sit back, students, grab your tea and turn up the volume because class is now in session. Call in at 936-2626 because your voice matters. Share your opinion on issues that matter the most to you. Good morning, K-Man. Happy Tuesday. How is everybody doing this beautiful Tuesday? Yes, indeed. The countdown to Christmas has officially begun. If, Santa has not marked your house for any gifts, well, I don't know what to tell you. You might have been naughty. I don't know. So we have got officially, let me tell you what we've got left. 7 days, 16 hours, 24 minutes, and 45 seconds. So you need to get on it and do what you need to do. Prepare for the holidays. Of course, Caymanians tend to have a big feast going on. So I know a lot of you are trying to get your fresh beef sorted out. I got mine secured. Thank you, Miss Laura. I need to make sure I get that. I'm supposed to get some stew kunk sorted as well. Our friend Anthony is going to be making us some kunk ceviche. Oh my gosh. Marinated kunk, as Caymanians would call it, really. Absolutely delicious. He made some for me the other day for our Thanksgiving feast. And all I can tell you is that was the most popular dish at the party. It went really, really quickly. So we are in for a fabulous Christmas, and of course, wishing you and your family all the best for the holiday season as well. But today is Tuesday, and Tuesday is all about doing a little bit of edumacation, as we like to say around here. We're educating you about health, all of the amazing things that Health City Cayman Islands has going on. And never a dull moment with them, because I tell you what, they're always stepping up their game a little bit. And we're going to check in with Shamari now to see if he's in a really good mood this morning. Good morning, Shamari.
Good morning, Sandy. How are you doing? Good morning, Cayman Islands.
How was your weekend?
My weekend was amazing, apart from one issue. So I can't bring out the big one today.
Oh no!
I'll bring out the smaller one. Yeah.
So they lost. They lost this weekend.
We lost this weekend. We still have a chance to make the playoffs, although a slim chance.
All right.
But this was a big loss this weekend. But I'm still in the Christmas mood. You see, I have my Rudolph glasses going on.
Absolutely.
And the male shopping day is 6 hours and 10. No, 6 days and 10 hours away. That's when
you guys gonna just leave it to the very last minute, huh?
That's when we hit the road to be shopping. That's the official male Christmas shopping day. 24.
Oh my goodness! So, wow.
We're getting ready for that. So I would say I'm prepared, but I'm not. But even in Sandy, I don't know how good your eyes are. If you can see that Christmas stocking in the back.
Yes. Oh, yes.
The Miami Dolphins.
I had to tell you a little bit of a joke, Shamari. We were in Miami on the 5th for a couple of days, and we saw something related to the Miami Dolphins, and Marlon was like, "Oh, we've got to get this for Shamari." I'm like, "Oh my God, this obsession is real."
See, Marlon's Right,
So
that's right.
yeah,
Good.
yeah. He automatically
That was
thought
a
of you when he saw the merch. So there you go.
but
We also have joining us in the studio today, Dr. Benoit. Good morning, Dr. Benoit.
Good morning, Sandy. Good morning, Shamari.
All right, so Dr. Benoit is no stranger to most of us, but Shamari, you do the honors in case someone is tuning in fresh this morning.
Definitely. So Dr. Benoit is the leader that we have at Health City who has multiple years of experience for what we would like to say his day job, the most important job in a cardiothoracic surgeon. So Dr. Benoit has been in the game for many, many years, was Dr. Shetty's right-hand man, and he bestowed us with Dr. Benoit to come to help us to set up Health City. And as you would know, this is our 10-year anniversary. Dr. Benoit was part of that A team that originally came in and has only helped to build the facility to where we are, and for all the advancements that we've seen that I think we can proudly say even prior, but now especially with the advent of having Health City at Camana Bay with our Health City in East End, that probably will be the benchmark for the Caribbean when it comes tertiary and quaternary care and all types of services when it comes to healthcare. 'Cause we offer the full gamut, full range of services. And we brought Dr. Benoit on today for two things. One, to discuss minimally invasive cardiac surgeries and a special case that we would have done recently that he does, more times than not over the year, but we definitely have a testimonial for that. And also, as we're coming into Christmas, to give some more great news about other parts of Camana Bay. So I know that you all will be excited about that, as well as everybody needs to listen intently and closely because we have 5 executive health.
Yay.
We're playing Santa today.
Yes,
away, but we were definitely going to make you work for it. So going to have 1 or 2 questions so that you can work for those executive health giveaways, which everybody is falling over themselves to also find out, Dr. Benoit, when we'll eventually be able to offer the executive health check at Camana Bay as well. But we'll also give some more information as the program goes on.
All right. Well, I had to reschedule mine, unfortunately, because I had to do my little tooth extraction, but I need to get in there and do my executive health check. So something that's really, really important for all of us is to, know our numbers. We keep saying that here in the program, but I can't stress it enough. Things change. Some people like to go years without knowing what their, blood sugar numbers are, their cholesterol, just doing a general health check. And I can't tell you that especially when you get to a particular age, it becomes more and more important for you to do this on an annual basis. So shall we start off with the testimonial this morning so we can kick off today's topic? Because this is a very, very interesting discussion this morning. All right, folks, here we go.
Is Samuel Joseph Mitchell. I am 75 and I am from that beautiful country, the Bahamas. The condition I had was a heart problem. My heart was beating, as far as I was concerned, irregular. But since I've been here, you know what has happened. It has been restored to good health.
When my grandfather was first brought to Health City, I expected nothing but professional care, but I did not expect for the staff to be as friendly and accommodating as they were. I expected also for the surgery to last about, say, a day or so, but the surgery only lasts for about 5 hours. I also expected for his recovery to be about 1 week in the hospital, but his recovery was speedily fast, and he only stayed in the hospital for 24 hours after his surgery.
This is the only scar I received from the surgery.
This is what we have seen over the past few decades, how cardiac surgery is being evolved. A major heart surgery, open heart surgery, can be performed with a small incision as 6 centimeters, and patient is getting discharged within 24 hours from the hospital. No pain, no discomfort, and getting back to work within a week's time.
I expect a full recovery from my grandfather. He has stated that he has had no pain since the surgery and he has been able to walk Almost immediately following surgery, he is able to return to all his daily activities and routines that he enjoyed doing so much, including playing with his grandchildren.
No doubt about it. I will tell Bahamians how good it is to come to this place.
Wow. I look at that incision mark, Dr. Benoit, and I wonder, how is that even possible? I mean, I know people just fall down and get a bigger scar than that. So, tell us a little bit about the minimal invasive heart surgery. What technology is making this possible?
Yeah, good morning, Sandy, once again.
Good morning.
This is a very interesting. It is all over the world. If you look at how the surgeries, not only cardiac surgery, everywhere, whether it is abdominal surgery or specifically if you ask GI surgery or gynecological surgery, urology, cardiac surgery, thoracic surgery, every surgery is going towards minimally invasive because nobody want to have a long, big incision in their body. And now with the advancement of technology and the better equipments and instruments and understanding about the physiology better than before, it is this is the way the world is moving towards now. Now, coming to cardiac surgery alone, see, maybe 2 decades ago, we all used to perform heart surgeries for the valves or bypass surgery for anything, a big cut from root of the neck towards the abdomen, maybe around 6 or 7 inches long, and the we have to split the breastbone into two halves, and then the surgery, and usually 2 or 3 days in the ICU, another 2 or 3 days in the ward, usually a week in the hospital. And then the problem recovery also will be a little bit of delayed because the long cut means more pain and more bleeding. All those things are there. So now, maybe last 10 years, cardiac surgery is very fast going towards this minimally invasive or keyhole surgery or whatever way you can call it. So uh, it was an evolution. Initially, we were doing the upper partial, means half of the same incision what we were used to do in the midline. The breastbone was cutting maybe half instead of full, but now we are going to the sides between the ribs. So now you saw this man who 75-year-old had the aortic valve was very significantly calcified and narrowed. He was very symptomatic when we came, evaluated, and we did the surgery. I mean, the surgery is everything same actually. We have to stop the heart, we have to open that heart and remove the valve and put the new valve. All those things are same, but we are going between the ribs with around 6 centimeters. In his case, it was only 6 centimeters. That's 2 inches or just more than 2 inches. By doing that, it is making the recovery totally different. See, after the surgery, within 3 or 4 hours, he was walking in the ICU. Then next day, in the same evening, he was sitting and having his soup. Next day morning breakfast, and by around midday, around 12 o'clock, he was out of the hospital. And so this is what is happening in cardiac surgery, especially for these aortic valves, mitral valves, some of the holes in the heart. Not all patients are eligible for these kinds of surgery. There's a few other
Right.
things should come together, but most of the mitral valve surgeries can be done through these keyhole surgery. Most of the aortic valve surgeries can be done this between the ribs, and there is a further to this. The aortic valve surgeries, especially for elderly people who are not very fit for going through this surgery. Now, no surgery at all now. we are doing here actually. So this is like an angioplasty. Through the groin, you put a there and put the valve in. Either same evening or next morning they are going home.
Wow.
So, there's no cut, absolutely no cut. So
Wow.
this is what the advances that is happening in the field of cardiac surgery, that is making life much easier for the patients after the surgery. And the fear previously about heart surgery means, or it'll be in the ICU, in the hospital, then after the recovery when they can go for the work, all those things were the main thing that was giving some anxiety or nervousness for the patients before going for the surgery. Now this is what situation changed. So it's very,
So,
and this is what is happening any advanced countries or the best hospitals, and we also have all this technology, all the expertise, and we are doing the same thing here. And people are now coming from other islands now asking for the minimally invasive heart surgeries, and we are doing, and the without cut that we call the TAVI or a trans aortic transfer catheter aortic valve implantation without any cut in the body. So people are seeking for this treatment from other islands. They are coming here, and in a week they are going back, because usually we will keep them on the island for a few days after the procedure, make sure that everything is gone. But they will get discharged within 24 hours.
amazing.
Yeah.
So, minimally invasive heart surgery, the keyhole procedure. So, are there different types of minimally invasive? I mean, you've mentioned two already. One, the keyhole, and then one going through the groin. Are there any other ones that you do, or those are kind of the two minimally invasive ones?
Yeah, there are 2, 3 ways of doing this. One is, as I told you, either cut the upper half of the breastbone or lower half of the breastbone instead of cutting the entire breastbone. That is one way of doing it.
Right.
Other one is going through the cut exactly what you saw in this man. That is mainly used for the aortic valve. If it is mitral valve, maybe especially for women or adults and girls, we go just below the right breast. That mammary fold is there, so that is very cosmetically also very good, because nobody will see that scar at all. So we offer that for that age group or for women. And then comes this without any incision, that one through the groin, like any angioplasty, what they are doing. So these are the different ways of doing this keyhole surgeries for the heart. Depends on the which valve or which hole, whatever is to be done for the patient.
Right. An incision of only 1 to 2 inches.
Yeah, yeah.
Wow. That's like nothing, really. That's so amazing. All right. So the benefits include reducing trauma to the body, because obviously the smaller the incision, the quicker the healing time is, less trauma during surgery. And you talk about the fact that there's certain ideal patients for this. So let's talk about who those patients are.
See, it is a little bit of technical. For the aortic valves, around the 70 to 80% of the patients will be eligible. If you consider this 3 modalities, like half cut of the breastbone, or between the ribs, or through the groin, around 70 to 80% of the patients will be eligible. Which of these depends on how's their valve, how's the aorta. I mean, that's mainly the medical conditions that they have. But I can tell you, at least 80% of the patients can be done through this keyhole surgery for aortic valve. Now, coming to the mitral valve, what we are doing around 70% to 80%, we are going through this between ribs. The cut will be below the breast fold. So that is possible. Now, who will not be suitable for this is most important. If they have any other procedures, see, like some of these patients will have 2 or 3 procedures inside the heart, like maybe a bypass operation with valve, or hole to be closed with a valve, or with the bypass. Or bypass
I
means
see.
called this coronary artery bypass. So these complex surgeries when comes, then it will be difficult to offer these kinds of keyhole surgeries. Otherwise, for the aortic valve or mitral valve, again, when these two valves comes together or three valves comes together in one patient, again, that's quite challenging to do with these keyhole surgeries. But those situations are usually very, very rare.
Right. Okay. And walk us through a little bit about what's actually involved in the procedure.
See, these patients also need a heart lung machine. That means we have to stop the heart, like any major cut surgery, also in these patients also. So, because of the technological lot of innovation and advancement, instead of going through the chest, we will go through a puncture in the groin, and then we will put the patient or connect the patient to the heart lung machine. Rest of the things are all same. There's either one small incision or a small puncture through the side of the body to stop the heart. Rest everything is see, it's all now. A lot of instruments are available now to make life easy for the surgeons. So there are thin and long instruments open only at the tip of the. See, if a scissors means it's like it has to go like this inside the heart or inside the chest. That is not possible. But if only the tip of the instrument open like this, we can put it through the hole, and the cutting part will open up like this. So like this instead of like this. So like this, so many instrumentation is there, so many instruments are there. So those instruments will definitely help us to go through these small holes, and rather than cutting the entire body. And the physiology also, now we understand, unlike 3 decades ago, how this body or the heart works when we put them on the heart lung machine. No need to cool like previously. We used to cool the body to 28 degrees centigrade or 30 degrees centigrade. Now we will not cool also for these procedures. So all those things will help, and eventually this will help in the blood transfusion. One is the chance of blood transfusion is very, very, very less. So maybe if you go through this minimally invasive, maybe 20% or less than 10% of those patients will receive any blood transfusion. Otherwise, maybe around 40% of the patients will get blood transfusion after heart surgery. Pain will be very minimal. Their going back to work is much easier. And the discomfort, what you call that, see, if you are in the bed after heart surgery for 2-3 days, that discomfort and the complications like the lung collapse, these all things are not there, because after 2 hours coming to the ICU, they are start walking, they are doing the physiotherapy. So overall, this makes they are going back to their work, or they're going back home as if nothing happened. This patient, what we showed now, they're telling their family members when they came to visit him in the Bahamas to his home, they could not believe that he had a heart surgery, because he was walking around in his yard, and that's after 3 days.
Wow.
So making
Yeah.
a huge difference.
Very
And
impressive.
And Sandy, just to mention that Dr. Benoit has done thousands of surgeries and procedures. Obviously, a lot would have been based on when he was in India and the amount of volume that he would have been able to do. And Narayana has always been at the cutting edge when it comes to cardiac procedures. And even more so now that we're in the Cayman Islands, we're always obviously getting the technology and the such to make sure it's cutting edge. But we have the physicians that are top of their game. Anytime we have either medical professionals and or facilities that come from the US, that they come, they look at what we've done, they look at our procedures, they look at our quality of outcomes, and they marvel at what not only Dr. Benoit, but what the entire team is able to actually accomplish, even to the point where I think we would have had Mr. Leon Joseph on this program last Christmas, and he's a thoracic surgeon, a
Yeah.
vascular surgeon, right?
This
He's a
was
vascular surgeon, and his wife was a nurse, and he wasn't able. He had a massive heart attack, and he wasn't able to speak. And she took over, and they were going to try and air ambulance him out. But when she spoke to the doctors, being a nurse that has been in ICUs and has seen medical professionals, and even though her husband was in charge of a full set of hospitals in the Northeast, she said, no, this is the best place for him to actually get his care. And sure enough, we saved his life. And afterwards, he was saying that, he never would have thought that in the Cayman Islands would have been the best place for him to have that surgery. But, God works in mysterious ways. And he happened to be here at a conference, had a heart attack, and he thinks he was in the right place at the right time for us to save him. So I want to make those points to say that in the future, if you have any cardiac issues, there's no need to go elsewhere. And the fact that we are right close to you now in Camana Bay, even when you want to come get a checkup, and or if you have chest pains or you're not feeling the best. Before it used to be a little bit of a trek to get up to East End, so maybe you might not have come in. But right now we're at Camana Bay, so there's no excuse, and we have the full range of cardiac surgeries as well as cardiac services, as well as across the board within your reach, right at Camana Bay as well.
Yes, absolutely. So we're talking about advances, Dr. Benoit, in technology that make this procedure possible, these procedures, I should say, including specialized tools. So tell us a little bit about what those instruments are, and of course, robotic systems as well, that allow for precise surgical interventions.
Yes, Sandy. It's maybe if I had those instruments, I would have shown you. These are smaller things, but it makes a huge difference for surgeons. See, like previously when we operate, especially the soft tissues. I'm starting from the cut onwards. The soft tissues will come when you cut it. It will come into the field like that. Now we get something called soft tissue retractor. It's a very simple, but whoever is invented that, so much thought. So it's a small, what you call plastic tube kind of thing that when you put it, and inside that you put the retractor and spread it. Even though the hole is such a small like this, you can use the entire because the plastic inside that is opening it, so no tissue will come into the surgical field. That is one. Plus the long thin instruments, as I mentioned before. So if through a small hole, if you look at that, and if you put a large instrument like that, your visibility is completely gone. We are not able to see that what is at the end of that instrument. So now we are getting very thin, like 2 millimeter diameter instruments that we are getting, and that will go through this small hole, so you can see that. Plus the heart lung machine, what we are when we stop the heart, those become very ultra modern, sophisticated, and what you call very safe through peripheral bypass. Previously, what we used to do to stop the heart and take connecting the heart lung machine through the big cut itself. Actually, now it is going through the groin with a small tube, and it's doing the same purpose. It's pumping around 5 or 6 liters of blood every minute. That was these are the things were not we could not imagine this a few decades ago. So it is the better understanding of the physiology, the innovation of better instruments, and overall the anesthesia. That's a very integral part of especially these kinds of surgery, because we have to stop one lung throughout the procedure. So the patients will be breathing through only one lung. The other lung will be completely stopped. So when these kinds of expertise, the very advanced anesthesia support, very advanced heart lung machine scientists who are there, part of this one, and the entire team. It is again, it is not Dr. Binoy alone at all, because these are the things we need a good team. They are also very experienced with these kinds of things, because the team, when we do these kinds of surgeries, around 10 to 12 people will be there, anesthesiologists, nurses, the heart lung machine running, the technicians and scientists and the surgeons. And when they come to the ICU also, it is the physiotherapist who should be very well aware about this, what is done, so accordingly they have to their mobilization, all those things in the beginning, the nurses in the ICU, the intensivists. So it is a big team and everybody should know their role very well. So then it will go like an very well orchestrated process. So no need to ask anybody during the surgery. Everybody knows what they are doing. So it will go like we can enjoy the surgery instead of having very tense situations inside. We used to, I can tell you that we used to play music inside the operating room, because we believe that the surgery, when we do, it should be surgeon should be relaxed actually. It's like Dr. Shetty used to tell, actually it's like a painting, a good painting. When they do the artists, they will be relaxed and they will take it their own time like that, and not worried about the any surroundings, so they enjoy fully into the painting. The same way the surgeons, when they do this surgeries, they relax and enjoy, then the outcome will be very good. Yeah.
Very good. We do have some comments coming in this morning. So, of course, good morning to everyone who's listening to the program. We will be giving away some executive health certificates, so make sure that you listen. Miss Jonice joins us this morning. She says, hello, Dr. Benoit. Thanks for the service that you did for my baby boy, Javian, in March of this year. Unfortunately, he passed away, but we will never forget you and your team did an awesome job. So sorry to hear of your loss, but still thankful for obviously the services that were rendered from Health City, Cayman Islands.
Very sorry.
Yeah. Yeah, very sad. So Dr. Benoit, we've been hearing this morning about this minimally invasive heart surgery procedure that's available at Cayman Bay, folks. Again, keyhole surgery being one of them, some really amazing technological advances. Can you tell us about the enhanced visualization and how the camera technology has also assisted you in making this procedure possible?
Yeah, so this is again the advancement of this fiber optic system actually. See, traditionally we use the light on roof of the operating room and the headlight what we wear. Now when you imagine that a small hole, these lights will not reach the target that is maybe around 10 centimeter in depth from the skin. So we need this illuminating mechanism, that is the fiber optic system. So we use that. So at the camera will be there, and that camera also is a separate port will be there. We use that camera through a very maybe 4 or 5 millimeter cut, and we put that through a separate hole, and that will give the entire area that will be lightened very well. So no need to rely on your headlight or on the light on the top of that. And we use this video scopes that will help us in seeing and better visualization. That again, this when we are going through the small holes, the visualization is exactly, it's a very important. So, and that video scope will be there, no need to go and look through the hole. We can see that like that, and the video will be there in front of you. We can see that, and we can do all the cuts and sutures and everything through that.
And just because obviously Dr. Benoit is using a lot of hand movements to show you the sizes, what we're going to need to do, I think, in the future, Sandy, as one of the videos that we
Mhm.
have a series of videos planned. Dr. Benoit is if we can take Sandy to
Yes.
an area and actually show her all of the
Yeah,
different equipment and the sizes and so that there can be a video series that will
Mhm.
play not necessarily on medical Tuesdays but medical rundown, but we can actually play those videos as well so that people can
Mhm.
see all of the equipment that you're actually speaking about and how
definitely.
precise and how small it is so that
Mhm.
they know what that, because otherwise people would never see it. So we can definitely give that as
Mhm.
further education for the future so that the listening audiences can come online and view and see
Mhm.
all of the equipment that we're
Yes.
speaking about. um, and
I think
and
I think in another life I might have been in the medical profession because I'm so fascinated by all of it. I mean, I'd love to see a surgery one day. Like I'd love to just sit there and watch because it's life changing. I mean, to know that someone can go in on the brink of death, really, and through medical advances, you're able to, give them a second lease on life. To me, is just it's fascinating.
No,
Mhm.
definitely, and just to further back up that, obviously Dr. Benoit has the expertise. He and the team and a great team of anesthesiologists and critical care
Mhm.
team. That Dr. Benoit, like he will always say, my portion of the procedure is anywhere between 20 and 30%, and it's the rest of the team that
Mhm.
come together, whether it's the nurses, anesthesiology, the ICU care that helps to get the person where it needs to be. So the fact that we have all of the specialities, all of the
Mhm.
physicians, the entire ecosystem of nursing staff and
Mhm.
ICU and the such in one place is what gives us the great, and as well as all of our protocols from an infection control perspective, etc., that gives us the type of
Mhm.
outcomes that we actually get. But outside of that, Health City would be the largest in private investor in healthcare. Since
Mhm.
we've been here, we've put over $300 million into the ground, into brick and mortar and equipment
Mhm.
and the such. That's outside of obviously the salaries and everything else that we would be doing. And then with the Kamana Bay itself, that's over $100 million that we would have put just in Kamana Bay,
Mhm.
the Health City at Kamana Bay as well. And prior to Health City at Kamana Bay now being fully operational, we would have had the Gene Thompson Radiotherapy Center that we
Mhm.
opened in March of 2023. So it's been a year and a half because we knew that we built it in such a way that we could treat hundreds of
Mhm.
patients before the hospital was open, because we knew that we would save lives doing it this way.
Mhm.
Because in a year and a half, it actually surprised us, right, Dr. Benoit, the amount of patients that we
Mhm.
thought we were going to be able to get there. But what we didn't realize is that a lot of people were actually holding off on their radiotherapy treatment because it was overseas and they either didn't have child care and or it just wasn't a good time. And even though it's critical, they were holding off. So when we actually opened, there were a lot of people who should have been going over previously, going overseas, that didn't. So there were things like that that we really couldn't foresee. But once again, we understood there was a need, and we put the radio therapy center right here, close to everyone, in Kamana Bay as
Mhm.
well. So we're excited. Sorry, go ahead, Dr. Benoit.
And I just, sorry to cut you. Say, I'll tell you, Sandy, what is the value of Health City. I'll tell you in one
Mhm.
photo. I'll show you. Okay, I don't know how much you can see this actually. Can you see this?
Turn
Yes.
it
Yeah.
turn it a little bit. It's gone.
Okay, I don't know how much.
Turn it
See,
forward a little bit, Dr. Benoit.
yeah.
Like tilt it forward so it can. Oh, there
Yes.
we go. All right.
Okay.
Oh.
Just 1 second. I'll tell you. I mean, 1 minute. I'll tell you.
Uh-huh.
This last night I was operating on emergency. One
Mhm.
56-year-old lady from West Bay.
Mhm.
She felt suddenly unwell. Then by the time she reached the government hospital, they had to intubate. I mean, they had to paralyze and because her oxygen level was very low, blood pressure was very low. Immediately they sent the lady here in the late in the evening, and we realized what was that the blood clot packed both sides of the lungs. Arteries were completely packed with the blood clot, and she was kind of maybe dying. So I could not even talk to the relatives. I told, rush to the operating room, removed these clots, and now she's recovering in the ICU. It's a complex operation. We have to cool the body to 20 degrees centigrade, remove the entire blood from the body, to open this lung pipes on both sides, remove this complete the clots from both sides. So this the happiness that we get is this lady in 50s would not have survived maybe another half an hour or 1 hour.
Wow.
So this is the value of health city, saving these lives.
Yes.
Everything is secondary or tertiary or whatever is not important. This saving this life.
Yes.
So we are there at the point of time, is because this time it's like anything actually that we have few minutes we get to evaluate and diagnose and take to the operating room. We have all the team available on the spot. Dr. Dhruva, our anesthesiologist, and the perfusion team, the heart lung team, the technicians. So within 15 minutes, we could move this patient to the ICU and be operated, and she's recovering now.
Wow. And that picture that you were showing us, what is that?
Blood clot. That is the blood clot
Those
removed
are the
from the
blood
lung.
clots.
Yeah.
Wow.
Yeah.
That's what you actually removed. That's
Yeah.
outside of the body now.
Yeah, this is removed.
Yes. Oh
This is
my
from
gosh.
both sides. I don't know how to show this. I can send
Yes, I can see. Send it to me on WhatsApp, and I can pull it up a little bit bigger on the screen. But that looks
Sure.
fascinating. Wow. Oh my gosh. I've never really seen. You think of a blood clot, but then you don't really know what it looks like. So this might be a first here on this program. We get
Yeah.
to
Those
see.
are in the lungs, right? That's why they look like
It's
branches.
called massive acute pulmonary embolism. It's a they will not survive for long.
Right.
So
Wow.
And that's why I was messaging Dr. Benoit yesterday. When he doesn't respond, I know he's in surgery.
Yes.
But then, so Dr. Benoit, how long were you in the surgery for?
it's around actually I thought around 10 hours, but it's finished a little bit early. Maybe around 6-7 hours I think it took.
7 hours. Yeah.
Yeah.
Wow. Amazing. Huh. So, I mean, the expansion, you talked about 70,000 square feet medical campus, including the Gene Thompson Radiotherapy Center.
Correct.
I mean, that's amazing, Shamari, that now we have Camana Bay. Will show, for those of you who've not had an opportunity to visit the Camana Bay location, we do have a video here that we're going to show you as well. But the location there at Camana Bay offers a lot of the same services, but also an expansion of services. So Shamari, tell us a little bit about what additional things will be available at that location.
So one of the major things, obviously, is the radiotherapy center for cancer care, so people don't have to go overseas for the radiotherapy and the fractions, as we would as they're termed, in the now or in the future. As well as from a pediatrics perspective, we have one of the top neonatal units now, the NICU units within the Caribbean, that will not only obviously save what people term $1 million babies, because it typically is $1 million for them to hold a bed, a neonate bed for you in the US. So we'll see the rest of the Caribbean sending to us, as well as obviously we'll save from Cayman as well. And I didn't realize how many people actually find themselves needing that service until we started doing tours of Camana Bay. I want to say of every 10 people that we would carry through, either between 2 and 3, believe it or not, either they knew of somebody or their sister or they themselves had an issue where they either had to go overseas and or needed some additional services. And then obviously we're going to have the full emergency pavilion. We're going to have OBGYN that's going to be there. Anything else that I missed, Dr. Benoit, apart from, obviously the other,
No,
everything else from orthopedics to neuro, to obviously cardiac will also be there.
everything will be there. Yeah.
Everything will be there. And at the end
All
of the
the
day,
imagings also.
sorry, go ahead, Dr. Benoit.
All the diagnostics also.
Yes, yes. All the diagnostics will be there, and a larger MRI, correct, Dr. Benoit?
Yes.
So that's the one thing for us big guys, right? The MRI East End, even though it's still effective, we listened as usual, and we made sure that the MRI is even larger at Commander Bay as well for us that are a little bit scared of the MRI machines. Even in Commander Bay, it's larger. And Dr. Benoit, I don't know if you want to give some of the good news now in regard to all of the services that will be opened. Well, prior to doing that, those
I just put up this picture. Yeah, it's so fascinating.
But I've seen this before because Dr. Benoit has done this type of procedure before. And
So
to me, it looks like branches.
Yes.
Yeah,
It looks like little,
This is the fresh blood clot. It develops inside the veins of the legs or the pelvis, and from there it's called deep venous thrombosis or DVT. You all would have heard.
Yes.
From there, it's gone to the right side of the heart and then to the lungs. So this is gone to the right, the top one, what you are seeing on the right lung, and the bottom one on the left lung. So it is completely obstructed the blood flow into the lung.
And this travels through the body. I mean, this is it can start because deep vein thrombosis normally starts like in the lower regions, like the legs.
Exactly, legs or in the pelvic veins, and from there it detach and travels through the right side of the heart and then to the lungs, through the lung pipe. So what happens?
And that's when it becomes dangerous.
Yeah, it blocks the entire lung pipes. Then what happens from the right side of the heart? The blood will not be able to go to the lungs. Then cannot come to the right. So and then there is no oxygen level will come down and blood pressure comes down, and usually they will have sudden cardiac arrest, and it will be very difficult to revive them unless so anyway, so this
I mean, if you can't breathe, then obviously you're gonna die. So wow. And you see, Shamari, when we travel long distances on the planes, that's why you see the ladies especially using the compression stockings. Because that's something that we are advised that will certainly help with those
long distance flights. Drinking a lot of water, that will
staying hydrated.
Hydrating,
yeah,
and walk in between.
So
I
not too much.
telling Marlon on that flight, and he didn't get up once to go to the bathroom. He didn't drink any water. I'm like, no, you're supposed to stay hydrated. Get up, go to the bathroom, drink lots of fluids. But he doesn't like using public bathrooms. So he's like, I'll just hold it for 16 and a half hours. I was like, oh no. So that's pretty amazing.
So Dr. Benoit, so that we can give the good news, I don't know if you want to tell the listening public what's available as of this Monday, as well as what's going to be available as of next Monday, and then New Year's, the complete story.
So the most important thing, Sandy, is we received approval from the Health Practice Commission for the entire hospital to operate. That is from the emergency to the outpatient clinic, the diagnostics, and all other specialties what we have there. So entire hospital is being given approval. So that is very good news. And they took a few sessions of this inspection. Everything is. They were very happy, and there is no comments. Okay, this has to be done. Or nothing was there. So entirely it was approved. So now, as you know, the outpatient department was started a month ago.
Yes.
Now, all the diagnostics are ready now. That means all the lab and X-ray, CT scan, MRI, PET CT, everything is ready. And we have started endoscopy and cath lab and all the surgeries from yesterday.
Wow, congratulations.
Thank you. Thank you.
This is good news. Where's my little applaud button there, Shamari? Hold on now. Oh gosh, I gotta find it. There we go. Yes, or virtual applause button. So
I thought you needed me to applaud. I was about to do it, but
okay.
Yeah,
we've got a button for that.
So
this is amazing. Congratulations. And of course, this is wonderful news for your patients, especially who are in town or the Western District. They don't have to travel all the way now to East End. So this is a bit of good news.
yes,
for
exactly.
sure.
Especially for the time sensitive for this heart attack or stroke and all that, you can straight go there and they can get the angiogram or CT scan and get the treatment done. So surgeries also started there yesterday. Now from this Thursday,
yeah,
we are going to have urgent care, that is 7 a.m. to 7 p.m. 7 days a week.
So 777.
Yeah. 7 cents. Oh, good. I did not think
7 a.m. to 7 p.m. 7 days a week, urgent care, right?
Yeah.
Nice. Wow.
That's
And
from,
so that means car accidents, Shamari.
No. So that's not the emergency.
That's
When I explained
tertiary.
the urgent care
Oh,
component.
the urgent care. Okay. What's the level 1 ICU center? Tell me about that. Is that going to be open as well, or?
no. So
yeah, go ahead.
Somebody, please.
No, go ahead, Dr. Benoit.
No. So this is the ICUs are functioning, but this when we say this urgent care, see, like anybody has any not feeling well, illness or any cuts or anything, without any appointment, they can just walk in. They can go to the urgent care. Okay. So our emergencies will be starting from the 1st of January.
Okay, gotcha. All right.
This is only the urgent care.
Yes, and we do have a video. Shaka, thank you for advising me about my camera. I'll do a refresh while we're playing the video as well. But we do have a video of the new facility in case you've not had an opportunity to visit it as yet. Here you go. You get a little sneak peek. Wow.
Ms. Samuel Joseph.
Oh, my apologies. I hit the wrong button there.
No
But yes, I mean, it is beautiful. Everybody's like, oh my gosh, what a beautiful facility. Marshall, strong-willed. And yes, if you guys have not had an opportunity to visit it, it really is aesthetically pleasing, but it's also functional. We're going to be doing a lot more of the behind the scenes video tours so that you guys get to see the functionality of it and why certain things have been placed exactly where they've been placed. Shamari, please don't forget the architectural team, the designers.
Yeah, we need to go through a list of the videos that we need to have. Plus, so the Manu and Lalitha bringing them on as well, so that they can do a medical rundown on in the new year. But just to repeat, so Dr. Benoit mentioned that as of this Monday, cath lab is open, dialysis, endoscopy, as well as elective surgeries. As of this Thursday, 7/7/7, so 7 a.m. to 7 p.m., 7 days a week. For all your urgent care needs, you can walk in. You don't need an appointment. Obviously, if you want to have an appointment, you can have an appointment, but you can actually walk in to get our services as well. And then on Monday of next week, Dr. Benoit, that's when the full pediatric with neonatology is going to start as well, which is one of those unique services that we're offering here at Camana Bay. That is one of you were mentioning the fact that we had a few services at Camana Bay that wouldn't be at East End. This is one of them, the neonatology with pediatrics.
That's a great one, trust me. Yeah.
And then for the new year, so we give you Christmas gifts, and then for the new year, we'll have the full emergency services that will be up at Health City at Camana Bay. And now that we have pediatrics, we can cover everything from an emergent perspective. At the end of the day, even in East End, when you think about cardiothoracic care, we have the only cardiothoracic team on island. From an interventional neurology perspective, depending on the type of stroke, and you get to us within the right time frame, we can actually minimally invasively go in and remove the clots from the brain that reverse the effects of a stroke. So you'll have no deficit if you're actually able to get to us. It's the right type of stroke that Dr. Romnish can deal with. And Dr. Benoit, I've never seen that one before. When you remove the stroke from the brain, does it look anything like what you would have just shown us, or it's a different type of?
Not like that, because the brain is a very small clots that can produce a very damaging effect.
Yeah, so we have, even prior to Camana Bay, we would have that expertise, but now we would have everything across the board right there. January 1, then everything will be open at Health City at Camana Bay 2025. So over $300 million in the ground, brick and mortar, with equipment that we would have gifted to the Cayman Islands. And as Dr. Benoit says, it's one thing to have these investments, it's a thing to have the medical professionals and the surround team, plus the protocols to give you the best quality of outcomes. Why people are traveling to us from Canada, from the US, the cruise lines. If in the US, everything is very litigious, but they definitely send their crew members to us based on the trust. And even throughout the Caribbean and Central America, we have everybody coming to get those services. And obviously now being in Camana Bay, we're looking forward to even more of the local and resident population coming to see us as well.
Okay, fantastic. So we got some giveaways this morning. We're going to do 5 executive health checks. So let me just refresh my screen really quickly just to bring my quality up. I can't have Shamari and Dr. Benoit looking better than me. I'm like what's going on here? Shaka, thanks for noticing that, because on my primary screen, of course, I don't see those things. I'm going to have to find out what internet provider they're using, because clearly. All right, so let me just refresh real quick. Shamari, get your questions ready so that we can give away those 5. And of course, get the phone lines ready, because you got to be prepared to call in. So give me one quick second. I'm just going to play your little beloved Cayman while I refresh. I think everybody is ready for some winnings. It is Christmas time. We love to give away stuff. So, 5 executive health checks. Tell us exactly, Shamari, what is involved in the executive health checks.
Well, Dr. Benoit would be able to give the best explanation of the executive health checks.
All
Dr.
right.
Benoit?
Yeah, but before that, I just want to tell about the executive health checkup, because everybody feels why I should do executive health checkup.
Yes.
I'm very good. I feel very good. I do not have any this thing. I am running marathon. I do not need. For those people, I just want to tell them to look at the website of FIFA. Okay, FIFA website. Yeah, and you look at the sudden cardiac death, then you'll find that in 2014 to 2018, that's a period of 5 years, they had 617 sudden death on the ground. That is from 60 countries, only from the 60 countries. During the play, 617, the football players had sudden death. And the average age was 34. It is there in the website, you can see that. And 85% of their due to coronary artery disease. That means you could have done, or you could have diagnosed this before, but you did not do that. So what I want to say is, I'm going to quote Dr. Shetty again. How healthy you feel doesn't reflect how healthy you are. Okay, so many things are going inside. You don't know. You may be playing football. Football players, we assume that they are the best athletes and very healthy. And in a matter of 5 years, from just 60 countries, 617 football players in FIFA had cardiac arrest or sudden death on the field.
Wow.
This is what I wanted to convey, that our notion before us always, when do you go to hospital? When you are sick, when you are not well. We have to change that. You go to the hospital when you are not feeling sick. Then you don't have to go to the hospital as a patient. So this is what we have to, it will take time for the general public to understand, but our role is to convey why it is important to undergo these tests, because you can see almost 55 to 60% of the deaths globally are due to cardiovascular and cancers. And both these can be screened and detected early, and the outcome will be totally different. If you find an early cancer, 70% of the cancers can be cured. If you find any plaque or a early block inside the coronary arteries or in the carotid arteries, you can prevent a heart attack or a stroke. So this is what we have to convey to the public, and I request. I am very big proponent of this executive health checkup, because I have seen the lives are changed, or this low dose CT scan of the lungs, or this pap smear or mammogram. How many people we have picked up early breast cancer, early lung cancer, and it is cured, compared to the stage 3 or stage 4 cancers, when maybe they live for 6 months or 1 year, but the quality of life is totally changed, that everything. So I just want to tell, before this announcing these questions and the winners, it is very, very important to go for this health checkup to understand how you are. Are you really healthy or not? Now, coming to what Shomari asked, there are different packages for this health checkup, basic checkup, mainly concentrating on cardiovascular and the entire thing, that cardiovascular with the cancer screening, including mammogram, pap smear, and CT calcium scoring. I mean, it's some 3 or 4 different packages are there. Depends on the age or the family history or their on previous health issues. We can choose whatever is appropriate for those people. We have a coordinator called Shalini. Sandra is very well known
She's
about.
awesome.
So she's very good. She also will suggest if somebody calls, okay, I am 45-year-old man, I have a history of family
Yes.
history of colon cancer. What would be the best package I should take? We are there to help out, but everybody should go for this. That's what my view. It is not. See, always when we say this, people will think that, oh, it's a little overdoing or not. It is maybe for some people maybe overdoing because they are coming out. Everything is good. It is not overdoing. See, I'm doing this regularly actually, so I know when I go for the checkup and I see everything is good, peaceful. Then even if I get a small pain over the chest, I know it is not a heart attack because I have done that angiogram. I mean, I do this CT coronary angiogram every 5 years. I can tell that. So that gives me that the comfort. Okay, I'm good. Otherwise, all assuming. Okay, you're looking. I have done marathon. Nothing will happen to me. It is absolutely no relation for running marathon or going for exercise. That doesn't mean that you are healthy and your coronary arteries or the carotid arteries or are free of disease.
Wonderful. All right. We're going to give some away this morning so you can get it.
So that's the reason you need it now.
Yes. Yeah.
Now,
get it.
the first question is, I'll make it easy enough. What year was the Gene Thompson Radiotherapy Center opened in the Cayman Islands? What year was the Gene Thompson Radiotherapy Center opened in the Cayman Islands?
9362626 is the telephone number. 9362626. Relatively easy question if you've been paying attention. He literally just said it about 5 minutes ago. So first one up, and I can tell you that these executive health checks, give you some very, very important information about your health. As Dr. Benoit said, you can look okay on the outside, but from a medical perspective, that does not mean much. Good morning, caller.
Good morning.
How are you?
Doing?
We're doing good.
I'm doing a lot better because I'm trying to do what the doctor just advised.
Yes.
Be ahead of the game, and I'm hoping I get this right.
Okay.
Oh, the answer now?
Yes.
I'm going to go 2023.
Yay!
Yay! There we go. All right.
Congratulations. That one was pretty easy because he did literally just say it.
That's okay. I didn't need no stress. I just needed it to be easy. I'm good.
So please WhatsApp me full name, and I do see the contact number here, and then I'm going to pass that on to the team at Health City, and they'll ensure that you get your certificate and you can get your appointment too.
Wonderful. Awesome.
All right, my dear. Thank you so much.
Thanks.
All right, so that's the first of 5. So we've got 4 more to go, folks. I saw some more people calling in. They were like, oh, I got to win. So I know a lot of people, these are coveted. I can tell you that there are people who were messaging me from before saying, when are they going to do some more giveaways? Because I really want to get one of these. So, it's a great gift. So let's do question number 2, Shamari.
All right. So question number 2 is, name one of the new services that will be offered at Health City at Camana Bay that isn't currently offered at Health City in East End.
All right, one of the new services. Again, yes. Easy one. If you've been half awake, half a cup of coffee, you know this one. And we've got some callers coming in. Good morning, caller. Welcome to the program. Hello, caller. Uh-oh. Hello, caller. Can you hear us? Hello. Caller, can you hear us? Oh boy, that's WhatsApp. Sometimes you gotta call straight line. Good morning, caller.
Good morning.
Good morning.
Everybody.
Good morning.
Good morning.
Do you think you have the answer for us?
I'm hoping so. I've been paying attention, and I would be really excited to get one of these executive checks. So I'm going to go with neonatal intensive care unit.
Yes.
Yes, good
You
job.
have to pay attention. Congrats.
I have.
Fantastic.
Thank you. That is so awesome. Thank you very much, guys.
Yeah, you're most welcome. And just WhatsApp me your details. I do see your name, so I do know who this is. But congrats.
Okay.
And we will get you all sorted out with that gift certificate.
That is so awesome. Thank you very much. Have a
Yeah,
great
you're
day.
most welcome. All right.
No
So
problem.
some easy ones so far, I think. Are you going to turn it up a little bit, make it a little bit more challenging?
Yeah, all right. So let me make it a little bit more challenging.
Now, first
Can
of all,
some-
let me tell you how
Yes.
excited. I just want to talk about the NICU because I'm one of those people who, 8 years ago, there's only one NICU on the island. I had to take advantage of that. Big shout out to HSA. They do have a wonderful facility there. But to know that there is going to be another facility available, I got to tour Health City and I got to the Camana Bay location. I got to peek in and see how their NICU is organized and situated. And for those of you who are, at that stage, you're having kids, family planning, you never know when you might need the services of the neonatal intensive care unit. And it looks amazing. They're going to have all of the expertise there, all of the equipment there. They've thought of everything. They've thought of patient comfort, obviously the latest and greatest technology for the little preemies that they'll be taking care of. So I want to do a big shout out because I think that this is something that we needed, more of because we got a few preemies being born on this island. So very, very important service. So thank you guys so much for that.
And Dr. Benoit, just from a technical perspective, what is it that we have there why you wouldn't need to fly babies overseas like done previously? So what additional offering is there that now is filling that gap?
Yeah, so this NICU can take the neonates, preterm babies as small as 500 grams. So usually when it comes to neonatal intensive care, it's the preterm babies with all those comorbidities and how that needs 24 hours doctor, nurses, and that expertise and everything is very important because the margin for error is very, very, very thin. So we have 5 neonatologists and very experienced nurses, 1:1 ratio, and all the facilities, all the equipments for whatever the complications or whatever the need of these preterm babies. We have everything to manage.
No, it's fantastic. And we'll do a special, I think, video in that section as well, Shamari, because it's quite impressive.
Definitely. So,
All right.
so the next question, when was Health City Cayman Islands actually opened? The first facility in East End. What date was Health City Cayman Islands opened?
936-2626. I see some people trying to call me in my personal number. You got to call the show number, honey child. 936-2626. All right, let's see. Good morning, caller. Do you have a date for us? Uh-oh, you got to turn that radio down before you dial the number.
2005.
Good morning.
2005.
2005. Shamari?
No,
sir.
No. That was well before Health City was opened.
Yeah.
Well
All
before.
right.
Sorry
Try
about that.
again, folks. So the question being what was Health City, the original one in East End, open? Now, if you've been paying attention again, you should have a fairly good idea. I see someone calling me on the wrong number, 936-2626. Good morning, caller.
Good morning. It opened January 14th, 2014.
So 2000, I'll give it to you. 2014, it was open. It's actually April 2nd, but definitely You got the year right,
got the
so
year
we can
right.
go ahead and give the executive health check away.
All right, you got the year right, so he's going to give it to you.
I used to read that every day. I was there for 3 months and 2 days. I just come down last week, Thursday.
You know, Miss Shalma, we missed hearing from you, and somebody was asking me just last week, how come we haven't heard from Miss Shalma in such a long time? And I said, well, I know she's been busy with some medical stuff, so I hope that everything is going okay for you.
So far, good news, thank God.
Yes.
God is great. And
This
Health
is
City is
wonderful.
great. I appreciate them a lot.
Yeah.
And everything is going good. Yeah, people were asking me out there too about when you're going back on the show, when you're going back on the show. Every day people ask me that.
Yeah, your voice is definitely missed, but I'm glad to hear that everything is coming along. You know, these things can be very, very
And
challenging.
I saw Dr. Benoit every day, and I asked him if he don't rest because he's a hard-working man. I don't know how he can hold out. I mean, he's a face that I saw early in the morning, last thing in the night. He's amazing. I don't know. He's an energizer bunny. I don't know how he do it, but he does it.
Yeah, well, that's so wonderful. And he, you know, the physicians there, they got to take care of themselves as well. So I know that he prioritizes his own health.
Yeah, and I went back on Saturday to do some stuff with my husband, and all the people, even the nurses from upstairs, when they heard he was down there, they run down. Oh, Mr. Billy, we missed you. Mr. Billy, we love you. We got the good news from Dr. Benita. Say yes, thank God. God is not out the wood yet, but we still got to do some procedures. But and I'm glad to hear about this big MRI thing, because that's what he afraid of, and he have to do another one. So maybe he'll have to take him down to Monterey to do that one. Because he got out of the Georgetown 1-2 times. So
oh my gosh, yes.
They had to sedate him to do it. So I guess they can talk because he can't make it now.
Oh wow.
That's the one thing. He can't make it. They tried, but they had to. They tried to tranquilize him and everything, but they have to sedate him.
Oh wow.
That's a definite. Yeah.
Well, thank you so much, and congratulations.
Yes, ma'am.
I really appreciate it, and I know that as a caretaker, you know, we have to. If you're a caretaker, you've got to make sure that you're taking care of yourself as well. So you use this executive.
I'm tired. I need that because I don't know what they're gonna find with me because everything do me right now. I'm up and tired.
Yeah. Well, they'll get you. They'll get all the tests.
Sleeping on a sofa, I tell you that not easy. But in the very doctor start to tell Billy, you have a good wife. You got a good wife.
Yeah. Oh my goodness. All right, love. Thank you so much.
Yes, ma'am.
All right. Congrats again, and Merry Christmas when it comes.
Same to you.
All right, darling. All right. So one of your current patients won. You know, I know she's been up and down at the hospital for a number of months now. So we're so glad to hear that her husband's doing some better. All right. So yeah, she can get her executive health check done as well. All right. We got, how many was that, Shamari?
That was 3.
That was 3. So we got 2 more. You still have an opportunity to win, folks. So what's the next question?
All right. The next question is, what's the level of investment Health City has made within the Cayman Islands in regards to our brick and mortar hospitals and equipment?
Give me the question again.
The level of investment.
Oh,
the level of investment, dollar amount that Health City has made in the Cayman Islands.
Again, he gave it away earlier. So these are all good questions. 936-2626. Good morning, caller. Welcome to the program. Oh, you gotta turn off the radio. Again, he gave it away earlier. So these are all good questions. Oh. Folks, turn the radio off. It's too much feedback. All right, so make sure you turn your radio off before you dial, because I try to answer pretty quickly. 936-2626. Call back if you want, if you can turn that radio down for me. Good morning, caller.
Good morning.
Hi, good morning.
Good morning.
Yeah, the question?
The question again, Shamari?
Yeah, the question was, what's the level of investment in dollars that Health City has made in the Cayman Islands?
300 trillion?
Say that one more time for me.
300 trillion?
No. Good guess, though, but say it again.
200 million?
Shall we give it to her, Shamari?
Yes, over 300 million is correct. Yes.
All right. We're going to give it to you. I think you were just confusing your trillions and in millions and billions. But we'll give it to you. All right. So go ahead and give us your name. You can send it to me in WhatsApp if you'd like. But congratulations.
Thank you.
All right, my dear. Sounds good. All right. I was like, she's a little bit off there. But that's okay. Shamari is feeling very generous today.
Yeah, she got it.
She had the number part right. The trillion,
Yeah. And then she came to the million, so all good.
Yes. All right. Final question. One of the previous winners says, super excited to have won something for like the first time ever. But your show is also very informative. So it's a win-win listening in. Aw. Fantastic. All right. Final one. Pay attention.
Dr. Benoit, you want to give a question or you?
No, you give please.
All right. So this one is come January 1st, what is our New Year's gift? Which area of Health City will be open on January 1st?
You're becoming a very, very tough question.
2025, January 1st.
Yes.
Which area of Health City will be open?
If they were listening, this one's not too bad. Good morning, caller.
Good morning. Is it the accident and emergency?
There we go. See, people are listening. You have a good class. Andy. Everybody.
Oh yes, they top students. They pay attention. So congrats.
I would like to gift my health check because I already had one.
Okay.
I would like to gift it to the next caller without them having to answer a question.
Oh wow!
That's Christmas. Pay forward. All right.
I know.
Merry Christmas.
Yes, thank you. Merry Christmas. So next caller, all you have to do is call in. Simple as that. She's paying it forward. This is fantastic. I love it. All right, who's going to be the next caller? You're getting it for free. There we go. Good morning, caller.
Good morning.
Good morning. Congratulations. You have just won. And you don't even have to do anything.
Perfect. Thank you so much.
So just WhatsApp me your name. I've got the number, but just WhatsApp me the name to go along with it. And congrats. And of course, I'm sure you want to thank that previous caller who just re-gifted her certificate.
Thank you so much, whoever you are. Thank you.
Yes, absolutely. Thank you, ma'am. Oh, that's so sweet. I love it. This time of year, everybody's just in the giving mood. So that's it, folks. All the gift certificates are gone. I see people keep calling, but don't worry. Health City's got more stuff coming into the new year. Are you going to be with us next week as well, Shamari?
No. This
Okay.
is our last program for the year.
2024. Oh my gosh. But we'll give away stuff in the new year without a doubt. So sorry, folks. That's all the winnings we got for today. 5 amazing health executive health checks. Again, they do try to make them as affordable as possible. I'm going to do mine. I was supposed to do it 2 weeks ago, but I'm going to get mine done. And it's just really, really important, again, to just know your numbers. And, there's so many little things that we all kind of know what we need to work on. Anytime I go by the facility and I see Dr. Benoit, as Ms. Shelma said, he's very busy. But the last time I had a good opportunity to sit down and have a little breakfast/lunch with him. And it's amazing to see his commitment to healthcare, not just from the perspective of, I'm just going to perform surgeries. He's like, no, do what you need to do to remain healthy so that, you don't have to come to me, or at least you offset how long it's going to be before I ever have to see you. So he's always given good advice about staying active, making sure that you're getting your steps in, you're standing up. And in 2025, we all are going to recommit to, we were supposed to do 50 by 50. Well, that didn't exactly happen, but we're going to recommit to it. We're not going to give up to a healthier lifestyle, better eating, better dietary, just habits in general. They've got the dietitian, they've got the nutritionist on board. They're going to be coming, and I want to do fun stuff, Shamari, for 2025. Like, let's go shopping. With the staff there, the dietitian, the nutritionist. Let's see how to take a traditional Caymanian dish and make it healthier. Like your rice and beans. Like, is there anything that we can do?
Definitely. And you're paying, right?
Yeah. At the grocery store. Oh Lord. We'll listen. We got the kitchen. We'll figure it all out. So we're gonna get in there and do some cooking. The cooking show is something we've been talking about for a minute that we want to launch. So I'm really hopeful that this year we can get that off the ground and stuff as well. So lots of exciting things going on. CMR is expanding our reach. Some things I can't tell you all about. The radio station, we're working on that. But there's another exciting development that hopefully will be coming down the pipeline at some point in the next several months. And you guys are going to be excited to hear about that one. That one's pretty cool. So yeah, lots of wonderful things. So I want to wish all of the team at Health City Cayman Islands a very, very Merry Christmas and a Happy New Year. And Dr. Benoit, I'll let you know when I'm coming in so you and I can sit down and chat some more.
Definitely.
We could do a whole show just chatting with Dr. Benoit because he is so interesting. Shamari, we should think about it.
Yeah, man, definitely.
He's committed to, so many things in the community, working with the Cayman youth and making sure the educational program there continues to evolve and strengthen at Health City. So lots of amazing things happening there.
Definitely. Thank you, Sandy.
Good. All right, guys. Thank you very, very much. Have a good one.
Merry Christmas, everybody.
Merry Christmas.
Thank you. Thank you. All right, folks. So now we've got open mic opportunity. So congrats to everyone. So again, if you didn't win, the winnings are over. I see some of you still trying to call me, honey. Yeah, I'm sorry. The winnings are over for now, but the WhatsApp number is the same. You can WhatsApp the same number. So 936-2626 has WhatsApp on it. So you can WhatsApp that number as well. Kashina, thank you so much. Hello to Miss Pat. Beautiful Miss Emma joined us. Miss Lucille joining us from overseas. Hello, Miss Flora. Marshall said, wow, it's indeed a beautiful facility. It really is. I must tell you. Okay, so let us get on it. Oh, we still got another caller. Good morning, caller.
Hi, good morning. Am I the next caller?
No, ma'am. We got a winner already. So sorry.
Okay.
Yes,
Bye-bye.
my dear. All right, love. Good morning, caller.
Yeah, morning, Miss Sandy.
Hi.
That was a good show. I was trying to get hold to Shamari. I lost his number, but anyhow,
I'll give him your number.
Yeah.
Don't worry.
Yeah. He's supposed to have my number, but
Yes.
anyhow, I'm not calling about that because that show is over. But
Okay.
and I understand so many people that are working. I guess it's not only in the construction department, but other departments too. They work, and during the week, the boss is right there, calling them every minute and whatnot. And they said, when 12 o'clock come on Friday, mostly in the construction department, they can't get hold to the boss. No answer. And, it's very bad when you work the whole week and you're depending on your money now. And when it comes, you can't hear nothing from the boss. He's gone off the island for the week and whatnot. I mean, something, I don't know what could be done. You can't go and beat up the person because they carry you to court and then you end up paying them instead of they paying you. But I mean, it's bad when people use their labor, they spread out in the sun, they get up in the morning, they go on the job and they work, and then when the end of the week come, the boss to him answer the phone. I mean, it's bad, and I understand it's a lot of construction companies that is doing that to the people. And if you don't pay your workers Sunday, if they're the one that you're depending on to get the work done,
Wow.
But then the boss, boss, he getting his money and he using that to do his business with, but the hell with the workers.
Oh my goodness.
I don't know what can be done about it. There is so many. I understand people telling me about it in my time when I used to do construction the whole day. It wasn't like that. Nobody. No, they paid you. They paid you Saturday midday. They would pay you. I remember working when I was working with the Arches and them billing work for Dr. Roy McTaggart. 12 o'clock on Saturday in his paint store. He paying you right there. And then now, like I said, people tell me up a few days ago, they call it that somebody owe them some money for like 3 months and they can't get their money. Well, I mean, it is sad. But anyhow, Sunday, you have a beautiful, wonderful, happy Christmas.
Thank you so much.
I also eat brownies.
Oh, I did make some this weekend. I must tell you. All right, we'll get you sorted out. Don't worry.
Okay. And can you get hold to Shamal? I need him to give me a call, please.
Yes, I'll send him your number.
Oh, thank you.
All right, not to worry. All right, my dear.
Okay.
All right, folks, 936-2626. We're basically 1 week out from Christmas, and things are starting to wind down. Well, tomorrow is exactly 1 week until the 25th. But we'll be going strong right up until, I think we'll do a show right up until the 23rd. Yeah, why not? Yeah. Okay. So we got a lot to talk about. Oh my goodness. What a hot mess. All right, so listen, I'm going to give you guys a bit of good news here today. Cayman star athlete, swimming champ, gold medalist, Jordan Crooks returns home today at 2:30. So you're able to go to the airport. I understand the ministry is still working on getting a flyer and whatever, but they did send out media notices last night. So we will be there. We will live stream his arrival this afternoon. So make sure that you tune in to our social media channels for that. We'll have it on Facebook. We'll see if we can do Instagram as well. That'll require me organizing 2 cameras at the same time, but I'll see what I can do. So I'm very, very excited. He comes in at 2:30 and the public is invited to come out to the Owen Roberts International Airport and welcome this young man home along with the rest of the team, the swimmers as well, as what I understand. So this is going to be fantastic. I will definitely be taking the time to be there. So yeah, love it. Jordan, back today. All right, so the Ministry of Youth and Sports, they're organizing this, and I understand they're going to post something up eventually. Some kind of flyer, but I figure I'll let you guys know first here on CMR. Okay, so someone visiting from the UK, welcome home, honey chow. Says, can I get a mug? Absolutely, not a problem. Take that back across the pond with you. We've got a couple that are over there already. So we've been monitoring international news because, you know, Cayman's not the only country in the world. Shocker, I know. But there has been a lot going on in the headlines. Oh my gosh, countries politically are a hot mess. We see Germany, the chancellor yesterday resigned, voted no confidence. So he has stepped down. France is having issues. Canada, the Canadian prime minister is thinking about resigning. Oh my goodness. So of course, the one in Germany has triggered a early election that's going to happen for them in February of this year. And do you know that this is only the 4th time that they've had a snap election in their history? Yeah. So pretty crazy. Now, listen, you can go and vote for Jordan. There was somebody was doing like an online poll, and we posted that on our social media pages. So if you did not get a chance to vote in that, please go and do so. And thank you so much for the people who are sending through their names. I'm going to just make sure that Shamari gets this. Thank you, young lady. So yes, you can go ahead and vote in that. But I can tell you he's like has a resounding lead already. But yeah, throw your vote in there. Why not? All right. Let me see now. Yes, thank you, ma'am. Very good. I got all the names now. Fantastic. Okay. So yeah, go online, vote in that online poll. And this young man, you know, he's such a humble young man. I know he doesn't really like a whole lot of fanfare and attention, but I hope that, you know, he'll allow us to indulge ourselves a little bit. He likes to just, you know, stay low key and get back in the zone and prepare and maybe just get some rest. But I'm assuming he's coming home for the holiday season, where he'll be able to get a little bit of R&R as well as some hopefully good Caymanian food. I don't know what his diet permits. I'm hoping he can cheat a little bit during the holiday season, but I have heard that both him and his sister adhere to a very, very strict regiment, and that includes like no sodas, and their diet is just, they're performance athletes. So, you know, I totally understand and get it. So yeah, they, you know, as they say, the proof is in the pudding. He does such an amazing job. All right. So we also wanted to extend our condolences to the Nepalese community here in the Cayman Islands. As we know, unfortunately, a few weeks ago, they tragically lost a young man who is a member of that community. I do have a little flyer here that they've asked us to share, and we were very, very pleased to share it. Here he is. So sad that Tara, let me just see if I can get it, Bahadur Shrestha was tragically killed, unfortunately, in a fatality a few weeks ago when he was riding his bicycle after work. So the Nepali community of the Cayman Islands, they're a very small and tight-knit community, and they do a lot within their community. They support each other. And you know, they always reach out to me and invite me to their events, and I really do appreciate it so much. And so we're very, very sorry for your loss. And, you know, I'm just so saddened that it happened in our country. So very, very sad situation right before the holidays. And they will be hosting a candlelight vigil for this young man. So if you would like to support that, please come out. It's going to be on December the 22nd, and we'll post this up as well. It will be December the 22nd, which would be this Sunday at 7 p.m. and they're going to have it at the 7 Mile Beach. And they've invited me personally, so I will definitely try to make that as well. So yeah, so unfortunate. Okay, so again, mark your calendars for that. I'll do that announcement for them now. All right, this was a young man who, unfortunately, the lady was at her Christmas party and decided to leave her event. Such a young man, you know, young man, had his entire life ahead of him. And this is just really sad that people have to, you know, come to paradise and unfortunately not leave alive. So we really extend our condolences to him and his family, I should say, rather. All right. So yeah, so there's quite a bit going on, folks, in the news. So we'll touch on a few of those things. We only got 15 minutes left. Oh my gosh. I got to tell you, since we shortened the show to 2 hours, a lot of days I'm like, 2 hours is not enough. But of course we did it because there are days when we have to run off to court at 10 o'clock and other things. Now I'm contemplating whether or not to readjust it. We can make the request, of course, to readjust it for the election season because, ooh, honey child, a lot's going to be going on. So let's talk a little bit about some of the election news that happened over the weekend. So the progressives continue to make their moves. I think they said they're trying to get 13 candidates together. They can't get a full slate. It's interesting, you know, that they're struggling with this, but nonetheless, it is what it is. So we have a photo here that they posted, I guess, on their social media pages. I'm not sure. Somebody sent this out, and this is some of the candidates that are going to be running in the election. Now, I see Alva Saku in here, and I did speak to Alva last week, and he said that he hadn't quite made up his mind yet. He was waiting until, I think, February when he completed his articles. But nonetheless, it looks like he is back in the throes, as it would be, with the progressives. So has he officially rejoined the party? Alva, I need to check your application because I know you've resigned, you've gone back a couple times, you've come out again. So yep, looks like he's back in again. So who do we have here? They're doing this four, holding up the four fingers because again, we figured it out. A lot of us was like, what is the Cayman 4.0 all about? Apparently, their Cayman 4.0 is them saying that this is the fourth leader of the party. So this is Joey Hugh now. And so they are, I guess, using that as a marketing tactic. Cayman 4.0. All righty then. So they had their seniors Christmas party. All the old folks came out, good for them. And they also had a fete of some sort this weekend, which was supposed to be a come out and what's it called? Come out and like, I don't know, vote or whatever. So let's have a look at what we know. So let's look at this picture first of all. You see some new faces here. So we have Sir Alden McLaughlin there on the far left. He is not running. And in his place will be, we understand, Roy Tatum. Roy is the one with the red shoes on. You know, I got to ask Roy, where on earth did you get red shoes from? Because I'm curious to know who had red shoes for you to buy. Wow, that must have been an Amazon special order. But there you have it, red shoes. Then we have next to him, Craig Frederick, AKA Festa. He's known for K-Mass Carnival. Next to him is Alva Saku. The young lady next to him, everybody's been asking me, who on earth is this young lady? We have no clue, Sandy, who she is. And so I didn't know who she is, or who she was or is either. And I had to do some digging to find out. Apparently, this is Barbara's niece. So Kearney Gomez's daughter, Crystal Gomez? Crystal, something like that. Crystal, I think, Gomez. This is her niece. So she's finagled her niece to run in Prospect, of all places. Ooh, honey child. That's going to be taking, like, Sabrina's going to be taking candy from a baby. Although, you know, I don't know who else is running in Prospect, but y'all love to split up the vote. So this was the only new addition to the party, female addition, that they have been able to get. And I understand that Joey Hugh, the new apparent party leader, because he's not yet been officially, they haven't done the formalities yet, although they're calling him party leader, but there you go. He said that they were struggling to find women, and they don't seem to know why they were struggling to find women. I'm like, oh, really? You don't know why? Okay, then. So Barbara has gotten her niece involved, keeping it a family affair, and she's the young lady there standing next to Barbara. Then we've got Barbara in the green dress. She keeps telling people that she's not running, but I don't believe it, because if she wasn't running, they should have had her replacement already understudying her there in Georgetown, and we've not heard of any replacement for her. So I'm not convinced. I don't know why she's telling people she's not running if she is running, but anyway, you know, maybe in her heart, just like the last election, she doesn't want to run, but you know, they're going to make her run. So she's not going to have a choice. Unfortunately, it's probably not up to her as much as she'd like to think. Then we've got Joey Hugh, who is supposed to be the new party leader. Next to him is Roy Tatum. Roy has been Alden's right-hand man and in the party for quite some time. Next to him, we have a stud muffin, apparently, likes to go around showing his male parts to people. Mr. Ebanks, what's the first name again? Oh, Lord, I can't remember his first name now. Jason? Something Ebanks. All right, so he's supposed to be running in North Side. Then we've got David, the twins. The twin that we elected is Christopher. No, we elected David. And supposedly he isn't running. And so Festa is supposed to be running in his spot. Ugh, what a hot mess. And then we've got Mr. Roy McTaggart, And there they are with the 4 fingers. So they tried to do this bring out the fat vote or whatever. Like how people in the past, Justin Ebanks, there we go. Thanks for that. How we've done, like people have done like rock the vote or whatever. But I don't know. I mean, I'm hearing that the turnout was dismal, to say the least. So let me see if I can find a photo that someone shared of the turnout. Hold on a second. Let me see here now. Who was it that sent me the photo of the turnout? It didn't really look good, but I think, there was another FET event that other people decided to go to. I'm a little bit, I don't know. I mean, the whole soca thing, are young people really into soca like that? I mean, maybe some of you are. I don't know. But I think that when you mix events like party events and you're drinking or whatever, I don't know if that's the time for people to be thinking about, oh, let me get registered to vote at the same time. I think you should register to vote when you're well sober. And you're like, okay, I know exactly what it is that I'm doing. This person says, yes, soca's for life, but you're also over 50. You're not considered young. Okay, young lady. I'm calling you young lady, but you're like 50 already. So yeah, almost 51 is no longer young. I hate to tell y'all. Y'all be like, yes, I want to wave my flag. Let's wave it. You're no longer young, honey child. So let me see. Hold on. I'm trying to remember who sent me the photo. Let's see if I can find the photo. So yeah, the turnout didn't really look that good. I mean, I don't know. Oh yes, here, somebody sent me a video. Hold on. Let me pull up the video. And then they sent a caption along with the video that said, hold on one second. Let me get the caption here. They were like, they wasted money on this event. So the caption said, PPM are not the party of the people. They sold out a long time ago. Joey as leader cannot connect and is not respected. Max 35 to 45 people at the highest point at their Soca Fet. Rock the Soca Fet vote or whatever the heck they were calling it. So here's the video evidence. And yep, here it is, honey child. I see some older folks there. I just saw that looks like Miss Christine. Looked like she was two-stepping with the little soca band. So, yeah, I expected to see more people than that. Lots of empty space. I don't know. Oh, gosh. And some of those are probably event organizers and stuff. Okay, well, no bueno. But any event, I said to myself, I mean, if you want to throw a party, just throw a party. If you want to encourage young people to come out and vote, I think what you need to do is you need to educate them in probably a very different setting. I don't know that, a drink in your hand and, you winding down with a little soca beat is the way to get you motivated to I guess you're not rocking the vote. You're socaing the vote. I don't know. But yeah, so there you have it. Gabby said they tried to have an event the same night as Rub-a-Dub. Somebody could have told them that was going to be a flop. I'm thinking that that would have been Festa's. This is his expertise that he is bringing to the table now, because he is the party king. He is what's the name of the man who never grows up? The character. Oh gosh, flying around with little wings and stuff. What's his name again? Oh gosh, y'all gotta help me out now. Think about children's books, Disney. Somebody help me out here. Peter Pan. He's like the Peter Pan of, soca fets and carnival and that sort of thing. So, yes, honey child, but what a hot mess. Kasia says the PPM only want to secure all the seats in Georgetown, Red Bay, and Prospect. Once they have those seats, they can dictate the new government outcome. The rest of the island won't get anything for a while. So definitely Georgetown has been their stronghold, and I guess that will maybe continue, although I see them losing some seats, Mm-hmm. I mean, I'm not going to make any predictions quite yet, but I think some of their Georgetown seats are a little bit in trouble. So, a couple of months ago, I told y'all they're like half the party, half a party, and half a party is no party at all, honey child. You got to have a full party. But they're trying, but they're not vetting their candidates very well at all. I mean, they're bringing on candidates just because they're younger doesn't mean that they're ready. And they're bringing on candidates with known issues. You don't need a candidate who goes around taking out his man parts and showing it to total strangers and brings that up in a job interview. Like, that's not the kind of candidate that you should be putting forward. Who wants that? We've had enough of that over the years. And we need to raise the standard when it comes to the people that we're putting into elected office. They don't offer anything of particular interest in terms of like professionalism or expertise. And then on top of that, you're introducing women beaters as candidates. Joey, please do better. We don't need men in there who have a known extraordinary history of assaulting women and their own children. Like, are you serious right about now? No, thank you. My gosh. Is it that bad out there? Y'all can't find nobody? That you got to pick womanizers and sexual harassers. And, like I said in my editorial over the weekend, power amplifies your flaws. And so those character traits will only get worse if those people get elected to public office, heaven forbid. And so, the party isn't going to tell you this information. And so it's my job to do so. I'm sorry, but if you're putting yourself out there for elected office, you have to be ready to be scrutinized. And beating women, domestic violence, yeah, we're going to take a hard pass on you. I don't care what else you think you might be bringing to the table. That says a lot about your character and who you are. All right, Miss Dee Dee, good morning. Mel, hey, Mel, are you back from your trip yet? Or are you still living it up in New York, Nueva York? She says, soca's for all, not many 50-year-olds jumping in K-Mass. I hear you there, honey child. Miss Pat says, educate, that is the key. El Rey says, Festa tried a thing, no repeat. In other words, it just did not work. I wonder who was the artist that they brought in, by the way. I'm not really big on soca, so I don't even know, but they would have dropped probably a pretty penny on that event. And given the dismal turnout, that was a waste of money. Anyway, Gabby says, I think they just try get drunk, vote, because some people ain't voting, because it's the same-ish, different year, Sandy. Ay, girl. We gotta level up. We gotta level up. Live Happy says, Festa, who is partying his life all through college and did not come back home with a grade. We would be stupid to vote for him. Research, people. You mean a grade or a degree? He didn't come up with a degree. Maybe he got grades. I don't know. Festa doesn't have a degree? Didn't he go to Hillsborough Community College? And then what did he do after that? I'm not too familiar. I know he was in tourism because he used to originally work for DOT. So somebody said Skinny Fabulous. Is that the name of the soca artist? An amazing soca artist. Never even heard of him, honey chill. What a mess. Somebody said maybe he's following a former leader of the party when it comes to beating women. Wonk, wonk, wonk. Yeah, listen, some of them, honey child, they have a history that is pretty well known. So, but I would have thought that, when you're thinking about bringing somebody new, that you try to find better than what you had before. At least that person is a lawyer and has a profession. These guys are just like working in sales. I mean, no particular expertise that they'd be bringing to the country, that's for sure. Ms. Vernita says, it's funny how they can find money to throw a party, but can't put together, build some cheap housing for their people. Well, y'all don't want cheap housing when a hurricane comes. Trust and believe me. Rashad says this event was Friday night. Rubber Dub was Saturday night. No way. That's even worse. Because then there's no excuse why somebody couldn't party both nights. Oh, Lord, have mercy. Yikes. That's not good. So their fete was Friday night and still nobody showed up, and Rubber Dub was Saturday night. Lord Jesus. Well, I think that says even more than what we thought. Shaka says this is testimony showing how out of touch these politicians are with the pulse of the young people's social scene. Yeah, I would have to agree with you. Them young people, they were like, listen, we're not even showing up. It's free, and we're not even showing up. But the drink's free too? Because you know when you have free food and drinks and people still don't show up, you're not doing too hot. That's for sure. So they did post a video. You're right, Rashad, it was Friday night. They did post a video on their social media pages, but you could tell they must have told everybody, come to the front, fet the vote, come to the front. And they made it look like that video angle, made it look like it was a packed house. Lord Jesus. Poor them. Ay. So I see the artist that came in. Where did he get that big chain from? What a waste of money, young man. He got on one big necklace around his neck that looks like, let me see if I can grab this video. Hold on. That looks like that's worth a pretty penny. Shall save your money and put that on a down payment on a house. And where is he from? Which country is he from? I don't know. I can't hear him yet, but hold on. He got one big gold chain and it looks like an X or something, and a big gold watch. Ooh, you young people sure can waste money on things. So I also saw the PPM out supporting the cruise port situation. Does that mean that they're in favor of building the port? Because they were out there holding signs as well. So the Caymanian story began with a ship. Well, I can tell you what, it wasn't a Disney cruise ship. It wasn't one of those mega ships. So kind of a different kind of ship, to be quite frank and honest. All right, give me 1 second. Let me pull in this video so that we can have a look at the soca artists that they brought in. Let me see here now. Like I said, I don't know who he is, but here he is.
You know what I'm saying, yo? This is your boy Skinny Fabulous, Cayman Island. I just reach. And remember, it's all about a big event called Fet the Vote. And make sure you don't regret the vote. So sign up and check the vote. Don't left the vote. You know what I'm saying? Bam.
Where's he from? I can't quite.
You know what I'm saying, yo? This is your boy Skinny Fabulous, Cayman Island. I just reach. And remember, it's all about a big event called Fet the Vote. Make sure you don't regret the vote, so sign up and check the vote. Don't left the vote. You know what I'm saying? Bam.
Skinny Fabulous. All right, Skinny Fabulous. That necklace is not skinny. And it's not really fabulous either. But anywho, lots of gold, lots of bling there. Young man, save your coins. Build a legacy of wealth. Not just, the things that last in the short term. The gold watches and the necklaces, honey child. I know you feel comfortable wearing that in Cayman because nobody not gonna bother you, but that not gonna last long. Miss Sarah says, if this was held in Georgetown, it's hard to get to the center and park thanks to all the beautification that they're doing. Oh my God, Sarah. I thought that was over. I thought that little strip that they were doing there by the post office was it. But can I tell you, they have dug up more. Like on the other side now, like right in front of the post. Oh my God, why? What on earth are they doing in Georgetown? It looks horrible. Oh my God. And it's not going to be done in time for Christmas. I'm going to go by there today. Will some of the vendors talk to me? Because I know they're pissed off about this. Seriously. It's an eyesore. And heaven forbid, I'm not doing no pile of Christmas shopping this year. I'm going to take it easy. But I tell you what, even if you wanted to go shopping in town right now, where are you going to park? They have torn up. Whose idea was this? This was a PPM project, This is one of their legacy projects. This was not a good idea. This whole beautification of Georgetown, ripping up the whole place to lay down bricks. Oh my God. Unbelievable. I cannot imagine how upset the vendors are, the businesses in that area, the ones who are still surviving, barely surviving, because a number of them have had to shut down. It's ridiculous. I mean, given at night, I mean, you'd have more options in terms of parking. You could pretty much park anywhere. But my God, no, sir. My Lord. I don't know what to say. It's just unbelievable. And I don't even think that whatever they're thinking, whatever magic they think is going to work as a result of all this so-called, as you put in quotations, beautification, I don't think it's going to work. Lord have mercy. It's a hot mess and then some. All right, let me see. Someone says FET the vote could have gone wrong for several reasons. Number one, wrong timing. We're in the Christmas season and everyone is attending holiday parties. Number two, mixing politics and soca. These two don't belong in the same sentence. That was the point that I was going with. I mean, that was what I was saying. I'm like, no. And number three, honesty over entertainment. We don't need to trick young people with a good time to get them to vote. Attract them with honesty. Let's talk about the economy, cost of living, housing, and more. They should have organized a panel discussion with celebrities to talk about the importance of voting and then let them perform if they wanted to. Where's that kaboom button? Hold on, honey child. Kaboom! You see, that's how you do it. Young people are interested, and I agree that you don't have to try a cheap trick to get them to come out and vote. You can, do other things. You can rely on the fact that maybe young people actually care about the state of things in this country. They care about the cost of living. They care about housing solutions. They care about the economy. They care about knowing why they should even get registered to vote. And then, of course, why you're saying that they should vote for you. I think it cheapens the whole process, and it does indeed make us feel like young people are not even capable of engaging at a much more intellectual level, that it always has to be about a party. When I saw it, I thought, separate the two. If you want to have a party, have a party. But if you want to encourage young people to vote, then let's get on it. This person says, morning, they are fecking, you know what they meant to say instead, the town up, past ridiculous. Someone said he's from St. Vincent, I'm hearing, or Trinidad. So one of those countries. People are tired of the PPM and all their old asses now. I'm just going to read this as I got it. But not only young people, but older people too. They effed up the Cayman Islands, and who wants them again? Strong words there. Skinny is from St. Vincent. Thank you very much. Appreciate it. Okay. All right. This person says, Lord help us if this is what we have for candidates. Yes, I think it's insulting actually to think that young people need a FET in order to engage. It shows their level of disconnectedness. Yes. Somebody says that not for me, not from me. Rub-a-dub was Saturday. This was Friday. So PPM Soca FET was for Soca FET for vote was Friday. Rub-a-dub was Saturday, and it was free. And you saw how many people showed up. Lord have mercy. Ay, ay, ay. Ay. Well, that's what you call piss poor movement. Live Happy says Georgetown has always been a quiet town, and that's how we Caymanians prefer it to stay. All of this improvement is not necessary. Oh, Shaka says they would have been better off bringing an influencer that the younger people demographics follow rather than a one-hit wonder soca artist. I don't know who he is. But then again, I can't profess to be a soca queen or anything like that. Gabby says, I hear they say that they're trying to make town look like Kimana Bay. That's what I hear. Why? Why would you need Georgetown to look like Kimana Bay? Kimana Bay is Kimana Bay. And I mean, I think the folks at Kimana Bay have done an amazing job, but they didn't just pave the roadway. They didn't just dig up the roadway and put down trees and pave it. Kimana Bay is like a 30, 40-year plan. I remember way back in the day when the DART organization used to be in Merco Center. They had like their headquarters up there when they first got started. This was a long time ago, honey child. And someone I knew worked there, and they showed me the grand plan. It was like 35 or 40 years of Kimana Bay, the town center, the housing. It was massive of what they wanted to do, their pad, as they call it. And I was like, wow, this is a huge undertaking. But it's not just throwing down some trees and paving the area. Kimana Bay offers mixed use. You've got people who live there. You've got office space, retailers. It's like a whole thing. It's a town center. And so the vision of Kimana Bay is much more than this so-called beautification project. I think somebody has gotten the memos mixed up. That doesn't make any sense. If they're aiming for Kimana Bay, they needed to focus on some of the businesses in town and having the businesses revitalize what they have to offer. I mean, some of those buildings in town look horrible. That's what needs to be revitalized instead of just paving the roadway and take away parking spots. What a hot mess. Jim says the beautification basically is only being done on one roadway, Cardinal Avenue, which is now no longer a roadway. Shaking my head. More roadway congestion and a whole lot less parking. Yep. I don't know whose brainchild this was, but anywho. Marjorie says, I have an invitation here before me now. The party was the 15th of December, Sir Alden's house. Oh, that was the senior party. So that was another party, which was Sunday last. The parking is real bad and the seating space is bad also. I used to go, time was 1 to 4 p.m. was for seniors. Yeah. So that was the senior party. And hopefully they had more people show up for the senior party than not. But, you know, I mean, that's great that they had a senior party. And that was nice of him to actually host it at his house because he's got lots of outdoor space and stuff like that. So, you know, the seniors remain an integral part of our community. Of course, we want to ensure that they're being taken care of. And most groups and people will do something for the kids, and they'll do something for seniors as well. Yep. I'm just looking at some of their pictures from the seniors here that they posted on social. So, yes, sir. Madam wearing her little straw hat. Yeah. Oh, yeah. Is that Miss Sweet 16? Hold on 1 second. That's Miss Valney? I know that Donna, her dancing like that, though. Y'all give me 1 little second here. Let me check this one out. Yes, sir. I tell you what, I love to see the little people dancing. Hold on. I think this is Miss Valney. We call her Sweet 16, honey child, because boy, at her age, she's still going strong. And she is still dancing down the place. And I believe that is her in one hot pink dress. Dancing with somebody, man. Oh, yeah, that's my friend. Okay, hold on. Oh, so cute. Look at the little boy joining in. My tweetums. All right, I'm gonna show these to you guys so you can see. Yeah, boy. That's where apparently the party was at Alden's house with the seniors. They were having more time than the Soca Fete. Ooh. don't know. The senior turnout wasn't all that great either, but okay. I'm looking at the cameras pan around. Okay, well, no, maybe not too shabby. I mean, they're not all seniors, but okay. He had open bar, well, yes, sir. Wee, look at Miss Valney. Lord have mercy, she moving good though. Yes, sir. Uh-huh. Aye. Hold on there, folks. I'm gonna bring you the good dance. Yeah, boy. Check these out. You guys are gonna love these. I love to see our seniors actually having a good time, so this is nice. Uh-huh. They even did a slow motion version of her dancing. I tell you what, you can look at some people and tell when they were hot back in the day, you know. Mm-hmm. I'm just saying. You're like, oh, honey child. Come and see her when she was 16. She'd be tearing up the dance floor. All right, hold on a second. Let me see now. Here she is. We got 2 videos. Here's the first one. Oh, yeah. Nice. Uh-huh. Over there, Miss Tommy. Ay, ay, ay. Woo. Uh-huh. You get it, girl? Yes, love it. She was having a good time. Dancing down the place, doing her little 2-stepping. Yes, sir. My sweet. Mm-hmm. She still got the moves. 84 years old. Oh my gosh, she's 84? Oh my. Somebody says that he's not a one-hit wonder. He's won several soca monarchs several times, and he's well respected in the soca arena. And they said, yes, that's Miss Valney dancing, and she is 84 years old. What a mess. This person says young people don't like soca, but with that said, they're so angry they don't want to hear from them about voting, but get registered young men and women and help us vote out PPM and more. Oh, Lord Jesus. Mm-hmm. So there's a few people who are on the fence about running it with the PPM, and I'm going to forward these messages to them because maybe they need to take the pulse of the community. Ms. Pat said they've destroyed our Georgetown. Jim says putting that money into a proper parking garage would have benefited more people. Amen to that. Jim, good morning, Jim, says, who calls a concert party rub-a-dub? Hey, don't talk about that rub-a-dub party now, you know. Them young people come up after you, John LaRue, and tell you. It's been going on. Rub-a-dub, I think, has been happening for quite some time. I guess that's a saying. I don't know what it means. What's a dub? What's a rub-a-dub? But it has meaning to people who are in the whole soca area, I think, John LaRue, which clearly is not you and I. So I don't know that we should speak on it because we just don't know what we're talking about. Dee Dee says, so taking away roads to drive on with all of these cars on the roads, do they have free parking in the plans as well? Not well thought out. Ms. Pat said we must do more to engage our youth and first-time voters. I agree wholeheartedly with that. Ms. Sue says, yes, other islands have some good dances for retirees having a good time, not Cayman, though. Well, you should have gone to this one, Miss Sue. Looked like they were 2-stepping. You could have joined right in. Good morning, caller.
Good morning, Auntie Sandy. How are you?
Hey, good morning. How you doing?
Oh, not too bad. Blessed and highly favored.
Oh, wonderful, wonderful. Tell me what's on your mind.
All kind of good stuff.
Yeah? Tell me. You're live and direct, honey child.
That's right. Getting ready for the season, you know.
Oh, yeah. Nice, nice, nice. Lots of food, I'm sure.
Yeah.
All right.
Every day's Christmas for me.
Yeah, every day's Christmas. I love it. I love it. I love it. So what did you think about this this Fet the Vote event?
It's very hard to say.
Well, based on the turnout, I mean, wasn't that impressive?
Yes, it was.
Yeah. Are you registered to vote?
Yes, I am.
Mm-hmm. What constituency are you in?
GT.
GT. All right. What part of GT? Let me hear the source for GT.
So we call it way part. Kenneth Bryan is.
That's Central. So you're in
Central,
GT.
yeah.
You're GT Central. Okay. All right.
Yeah. Sound Road.
Yeah.
With Moshimo Drive.
All right. So we hear there's a couple people who we haven't heard any official declarations yet, but we think a couple people might be running in that area. What kind of vibe have you been getting so far for Georgetown Central?
Well, I'll be very honest with you. A lot of people have lost a lot of constituencies behind behind Funkatine, because a lot of those people, Flowers, bought out their homes.
Flowers bought out their homes to do what?
Well,
they're
developing. He's been buying up a whole. Yep, he's been buying out a whole pile of stuff down in Tiscrannon.
Oh, really?
Yeah, he bought
okay.
He bought the Jimwood Bar and everything down there.
Really? Wow. I mean, you can't buy what's not for sale, but okay. So what used to be residential areas is going to become what now?
Well, you know what he's been doing now to buy these properties, to force people to sell, raising his property, and for it to flood out the next man's property. That's not nice.
I didn't hear anything about that. So what property, I'm trying to fix exactly what this location is. So this is where now? This is the area they call down in the east, or no?
Yeah, that's where it is, down in the east.
Okay. Wow.
And he bought a where part, where part the fish shop was?
The fish
on Sound
shop.
Road.
The fish shop on Sound Road. That's on the main. That's on the main.
Yeah, like you're coming in before you get to, like, as you're coming in, it's right there on the right hand side. Used to be a little restaurant there before. And it was a lady there by the name of Miss Pansy. And he raised the property, and all her property went out, arena got flooded out.
Oh, wow.
So she had to wind up selling it now to him. That's the part they have like a nursery there into the yard.
Oh my goodness. Wow.
Yep. So that's what he's doing, raising the property and flooding out the poor people that who've been there for years and forcing them to move. That's not nice.
Yes, I wasn't even aware of that. So that's interesting. Oh my goodness.
Yeah, man. You know what I mean? People that who've been in location for years on top of years, and you buy next door to them, you raise your property now and you can flood those. No, man, that's not nice.
Yeah. Oh, wow. Huh. Well, I mean, people got to hold, wait, what they got to do is fill their land more to meet his, but, hold on to your property, because that's prime land right there.
Yep. My uncle sold out all his parents' home and apartments and everything that they had down into that area. But his son, they want his place to buy also, but they're not selling.
So where's your uncle going to move to, I wonder?
Well, we call him. He already moved out there years ago. You understand me? But,
okay. I see. So he just had the land there. Oh my goodness.
Yeah, and he had apartments. His parents' house was on it. He had that rented out. Plus, he had other apartments on the property. So,
well, they must be offering a good price for people to just sell out like that. I mean, wow.
Yeah,
but that has been the Caymanian story for a hot minute now. We always selling everything out.
Yeah. And then they talk about Dart coming by up all the land and all this stuff.
No, apparently not just Dart.
No. Like what we call it, what this thing, like what they have on we call it on the TV there, if the price is right.
Yes, my Lord. Somebody sit down. You're close down by Miss Alrita?
Right.
Aye, all right. I'm a friend, Very good.
Okay.
All right, honey child. Well, thank you so much for the phone call.
Okay, and you stay
Appreciate
safe
it.
for the
Thanks.
season.
Thanks. Same to you. Merry Christmas when it comes.
Okay, thank you.
All right,
Same here.
darling.
Okay,
Justice will serve says, don't see you dancing, Sandy. Need to come to Mango Tree and let loose. Ooh, honey child. Miss Marjorie says, I want all educated, classy, experienced people. No hurry come ups for me. Well, there can be a balance, I think, between experience and educated and classy people, right? So it's about finding that sweet spot. And unfortunately, so far, a lot to be desired. Miss Sue says Rubber Dub played 90s music and they had a good time. Live Happy says these promoters bring ghetto entertainers to Cayman. I'm sick of it. Why can't they bring down somebody like Sade, someone with class? Oh, I would go see Sade. Oh my gosh, she's so beautiful. Shaka Zulu says, well respected by whom? Certainly not folks that have a pulse on the soca scene. Oh my God. There are at least a dozen other current artists that could have been chosen, such as Kes or Marshall. But listen, aren't those the same ones they bring every time though? I mean, soca certainly has more variety, so they probably wanted somebody different. Plus, Kes, I think you would pay a premium to get Kes here, and maybe their budget was somewhat limited. Denny says, Dee, actually the ultimate long-term plan is to take all cars away from the lower class members of the public, so don't underestimate them. Say what? Oh my gosh. Miss Brenda says that's not Scranton. I mean, I was trying to understand, Miss Brenda, exactly where he's saying that they're purchasing. And of course, I'm thinking where the new building is, which is Elgin Avenue, and behind there. But there's not really homes behind that, right? Because that's all, what's the name of that whole plaza? I mean, you see how quickly that building's gone up. I was looking at it just yesterday, day before, and I'm like, oh my gosh, that building looks like it's almost done on the exterior. But yeah, you know, that whole, listen, all of Georgetown, no matter whether it's Washington Boulevard area, AKA Swamp, Dog City, all these areas have value for big developers, for any developer, to be quite frank. And so there is, as Live Happy says, this sounds like aggressive gentrification. There is the thinking that, you know, people are buying it up and they're going to be putting all sorts of commercial property on there. And soon there will be nothing left. Paula says, well, at least Flowers is Caymanian. It's better for him to buy it than Dart. Well, does it really matter if a you know, multi-story building is going to go up there instead of residential homes? Do you really care who it is that's purchasing it? And for the record, Dart Caymanian now too for many, many years. I forget when he got that, but he's had it for quite some time. But does it matter if it's a Caymanian who is going to put up a 10-story building? Does that make you feel better just because it's a Caymanian? Justice will serve says, good job, Alden. Don't watch the people who criticize and hate what you do. Just do it anyway. That's been his MO. It's like the school. Someone says, yes, it's gentrification and Kennett's Park is playing into it. Oh, Lord. I don't know that the people want a park that badly, but anyway. All right. Let me see here now. Let me see. All right. So good morning. He's turning those properties into parking lots. Oh, you mean the ones that Flowers is purchasing? Oh my God. What a hot mess. Okay, I got your message. Let me see if I can assist you with that. They said not for the show. I'll reach out to my contacts at that institution. Well, folks, we'll be talking about all that and much more. Buying all the poor people out and who you think will benefit. El Rey says down in the east behind Funky Tangs. Yes. That's what I was asking, if that's where it was. Yep. Why not introduce, says Miss Brenda, our young people to their culture? Swanky band would be a good start. Our young people have no clue of who they are and where they come from. They're just following what they see on social media. The lack of knowledge all over is the biggest problem we're facing. Amen to that. Let's give Miss Brenda kaboom. Cassius says a park. Is that what the people in Georgetown Central need? An intelligent individual can see through the smoke screen. Well, parks have been a thing. I mean, obviously, there have been a number of parks put out in other communities. So maybe he thought that Central needed a park as well. They don't really have many green spaces in Central. So on the one hand, I can understand the desire for a green space. But I know that some people have raised a concern with me that in that particular area, what is going to happen is that's going to be a park for the druggies, because of course there'll be no controls put in place after the park is done. And, that's going to be a place for all the druggies to be hanging out and, sleeping in and all that kind of stuff. So hopefully there's a plan of how to make sure that young people can be safe in these green spaces and, come out with families and still have a good time. All right. All right. So headlines again, in case you missed it earlier, we will be welcoming Jordan Crooks home this evening. Welcome home at 2:30 at the Owen Roberts International Airport. The fire. Oh, let me show you guys this, because I know yesterday we talked about the migrant situation at the Boddentown Center there, but we did not, I didn't get an opportunity to share the fire video with you guys. Oh my God. Well, that place is a complete, it's gutted. I'm surprised that nobody actually got killed in this. I really have to tell you. Let me show you the video. I guess they all got out in the nick of time, but look at this. Oh my God. It's horrible. Wow. Those people have lost everything now. I mean, they didn't have much before, but it's certainly gone now. My Lord. No, sir. We're going to have to, we have to knock the whole building down now? Oh my God. Lord Jesus. Unbelievable. So sad. That's our Civic Center, folks. My goodness. Wow. Shocking. So obviously they've been relocated as a result of that. They're now being relocated to the Breakers Civic Center on a temporary basis. Lord Jesus. Not another Civic Center. That's clearly not built for purpose, and the same thing is going to happen. Good morning, caller.
Good morning.
Hi, Miss Brenda. How are you?
Hello. See, you get your second Christmas gift.
Yes, and don't worry, we still got a whole week left, so I might get more.
Exactly. And you got a weekend that separates this week from the Christmas week.
Yes. Do you prefer Christmas to fall on in the middle of the week or a weekend? So you get like a full long holiday weekend?
Well, to be honest with you, I always liked when it fell, say like on a Thursday. And then you got
Yes.
Friday, Boxing Day, so you got that extended weekend.
Exactly.
Yeah. Or Monday, Tuesday, so that you had the weekend following up.
Exactly. Yes.
But
And it's kind of strange when it falls in the middle, to be honest, because then some people actually have to go back to work.
Yes, and people, at least I know when I was working, I hated if it came, say, like Tuesday, Wednesday, or Wednesday, Thursday, because then, you had to get up Friday, go to work, or whatever. But anyway, I think that as long as, and well, obviously the damage is already done, but people don't celebrate Christmas for the reason it should be celebrated. So, I mean, to me, as long as you know why you're celebrating it, then, you can prepare accordingly, regardless of what day you have to go back to work. But obviously, if people are in a festive mood, and dancing and partying, even in their homes, they'd like to sleep in a little bit late if they were up late. So, but I guess, we can't have it all. I see I'm a birthday person, so. Yeah.
Yes.
Anyway.
Yes.
But what I wanted to say, Sandra, about the Civic Center, right? But not just the Civic Center, because I've been bitching. Excuse my French. I'm sorry. I got you off the radio.
Yeah, that's fine. We're good.
I've been about this for quite some time.
Yes.
I just do not understand. Why is it that we have these Cubans here for all eternity? I mean, when they turn up in Miami or in the U.S. waters, the Coast Guard picks them. If the Coast Guard find them, they pick them up, and they don't. There's no business about bringing them on shore and processing them. They say don't come. So if they find you, they load you on the Coast Guard, and they take you back to the Cuban water, and then the Cuban Coast Guard meets the U.S. Coast Guard, and they take them off. And that's their business afterwards, whether they're allowed to go home or go to jail. And I am befuddled as to why the Civic Center in Bordentown, which is the hurricane shelter, is being used to house these people. These are the most ungrateful people that God has put on this earth. And I'm sorry, and I don't care who likes this. They belong to Fidel Castro and his regime, because he's the only one that knows how to keep them in place. And the money that our government is spending to keep them, I don't know what the amount is, probably more than it is to keep a prisoner. That money could go to all of our needed children. That Civic Center, if it was going to be converted into housing for them, could have also been converted into housing for the homeless Caymanians that we have. So I don't know what the story is behind it. I do know that Cayman has some treaty with Cuba, but I believe the treaty is that they would keep them here. Okay, well, if you already know you're not keeping them here, why do you have them here for 2 years or whatever amount of time they have them here? And then when they do return them, they're taking home 5, 6, 10, maybe. No. Cayman Airways seats over 100 people. I think it would only require 2 flights to take them all home, because they're not going to grant any of them asylum. So why are they keeping them here? They don't want to be here. That's what this rebellion is about. They want to get to Miami, okay? So take them back to Cuba and let them figure out another way to get into Miami. And I can tell you, we're going to see a lot more of this, because everybody's going to be trying to get there before the 20th of January. So the numbers will increase. And I don't know if you know the answer to this, Sandra, because I'm not that familiar with maritime law. Why is it that when boats pick up these Cubans who are adrift, why are they bringing, well, not why are they bringing them to Cayman? I think the better question is, why is Cayman accepting them? They're not Cayman national, and Cayman is 90 miles away from Cuba. So if you can reach Cayman, why can't you take them into Cuba? Why?
Yeah, I
why-
mean the law. I mean, we talked about this yesterday, and the law does prohibit us from doing a lot of what you're suggesting. And I have asked the authorities because I think it's something that is worth them coming and explaining to the people of the Cayman Islands. You know, we are beholden and obligated based on international obligations because we are still part of the United Kingdom. So the United Kingdom has signed
all
on.
countries are, even the sovereign countries. And if we're going there, Jamaica is just, I'm just saying, Jamaica is just as close. And Jamaica also they have more than a trading agreement still in effect with Cuba. The point I'm making is, why bring them to Cayman? You have several islands that are just as close. Why Cayman? Is it because no other island would take them? Because they have to radio ahead to say we've got drifters, whatever they call them, people at sea, lost at sea, whatever they're called. Is it that they have called Jamaica? They've called what's the other islands there around north of us, Hispaniola and those places, and they said no, don't bring them here. There has to be an explanation. Because it makes no sense to me geographically why they come here. You know, it's like that Panamanian boat that time that picked up some and brought them in here. And look at what they did out there. Refusing to get off the boat, and the boat is sitting out there. Did our government have to pay for that loss as well? Why were they brought here? Like I said,
we can, like I said, there are legal reasons why, but I can I'll reach out. I have already reached out to CBC because I think they need to have a conversation with the people of the Cayman Islands explaining exactly how this works. They have in the past, but it's worth repeating. And so I did reach out to them, but I'm still waiting a reply. So as soon as
they really need to satisfy us. I mean, I know in a case of sickness, if you are on a boat and you need to get to a hospital, yes, they bring you to the closest port. But that's a whole different story. And that's humanity. Okay? But not in a case of where if Caymanians decided to run away from Cayman and they were out there drifting at sea and they were picked up, I do not think they're going to take them and carry them to Bermuda or to Canada.
Well, it depends on where they're found. If they're in international waters versus Cayman waters.
Exactly. I was going to say, depending on where they were found. And in a case like that, they would try to find somewhere that has a British embassy. So, because we do belong to the UK. So they would find somewhere that, you know, you could take them ashore, get them sorted out, and return to whichever territory they came from. So I still don't understand why is Cayman the destination. That is what I have a problem with. And it certainly ain't because they couldn't reach somewhere else. If they could make it to our port, there are a lot of other ports before you get to us. So
All
we
right.
need to answer that.
Thank you, my dear.
All righty.
I appreciate it. You
Okay.
too. All right, dear. Bye-bye. So yeah, this is a question. I don't know if let's try and see if Mr. Manderson is available. I know he's equipped to answer the question, although he probably doesn't because it falls under the responsibility of CBC. So he probably wants CBC representative to answer it. But I do know that it's not quite that simple. There are international obligations that we have to adhere to. And it does depend on actually where they are found. If they're in international waters versus Cayman waters, if their vessel is not seaworthy, we have an international obligation, maritime obligation, to assist them, which oftentimes means bringing them on board. And so a lot of their vessels are oftentimes not seaworthy. And so what that means is we can't just leave them out there and allow them to, you know, just die. So there are, and once you bring them on shore, then there are requirements of processing them, et cetera, that have to be adhered to. So we have our CBC policies, and that's where then all of this comes into play. This person says, good morning. Legally, we have no choice in accepting them. Unfortunately, we signed up to the Human Rights Commission, and the Cubans know that. The first thing they say is that they are political asylum seekers, and that puts them in another category. So that's right. Once they have indicated their intent to apply, and they actually apply, we cannot just send them anywhere or put them on a plane and even send them back to Cuba. We have to process their application. So, yes, so there is that. And I think that a vast number of them actually do apply for political asylum. Now, how many get it? I know the caller is saying that we don't grant it to them anyway. We do. A number of them have gotten it. And we've seen that one gentleman who, is always out there protesting and doing the most and commandeering the Panamanian ship. He has political asylum. And remember, his beef was he wanted his wife and child to be able to get it on the basis that he has gotten it as well. And that's not how political asylum works. So we'll continue to ask the team there if we can, get somebody on board to explain all of this, because it really does require, I think, a frank and open discussion. We were trying to arrange something earlier in the year with Mr. Clifford and his team. Unfortunately, that never happened. But to the point that I was making yesterday, I did confirm that the Customs and Border Control Act was indeed updated, my apologies, to make it easier to deal with asylum cases as well. And the ones that are at the Civic Center, they arrived before that legislation was in place. So that's one of the issues, is that they have these legacy cases. The legislation has been adjusted, and these legacy cases are still having to be dealt with. So that continues to be an ongoing issue. Yeah, what a mess, honey child. All right, we're going to go ahead and end the program here. I know we went a little bit into overtime. It's a hot mess. Denny says, Dee, do you remember what Minister Brian Keeman Seymour said regarding public transportation? I don't, but maybe we need a refresher. Good morning, Miss Sherry Ann. How you doing, honey chill? All right, that's what we got for you. Wishing you guys a fantastic Tuesday. Go out there and please be safe on our roadways. Lots of traffic, lots of congestion. Just take your time with the driving. There's nowhere that you need to be in a hurry that is going to be worth you having an accident for. Trust me. So slow down, look out for other drivers, look out for yourself, and we'll see you guys here tomorrow morning. I think we may be having a special guest. I'm still waiting on confirmation regarding the election office. So, of course, you got to get registered to vote. There is a deadline that is coming up for that. So I encourage all of you. You won't have an option if you're not registered. So at least get registered. I hear people say, I'm not going to vote. I'm sick and tired of this. At least make sure that you're registered, just in case. Be registered. Make sure the elections office has all of your updated information, and then we'll take it from there. So Ms. Brenda says they should make every one of them work and rebuild the Civic Center. Well, first we need to try to figure out what has caused the accident. Again, there's been no confirmation of that as yet. But ultimately, in my eye, the blame is on the Cayman Islands government, because they've allowed those people to sit there for years and put together that facility, which I showed you guys in May what the inside of it looked like. I mean, you saw it firsthand for yourselves. I said at the time that this is a fire hazard, and apparently no one took me seriously or took the situation seriously. So I'm not surprised that this was the end result. It was just shocking what we saw. And, wires rigged everywhere. It was unbelievable. I'm surprised they didn't have a fire before. So we'll have to see what the issue is. It probably some electrical spark or something that went on there, because I can't imagine what the load was with all of those different appliances. Some of them, most of them, if not all of them, were secondhand appliances, because again, the government didn't give them anything. So they all needed little refrigerators and whatever. So they went and picked up things that were broken down and they tried to fix it themselves. So maybe one of those, sparked off, and that's what caused the fire. We'll have to wait and see what the official fire report says about that. So Shaka says that's right. Register. You never know what can pop off that might entice you to get involved at the last minute. So absolutely, we want to encourage everyone to get out there and register to vote the next general election, April the 30th. Folks, enjoy your day, and we'll see you tomorrow morning.
Thank you for tuning in to another episode of The Cold Hard Truth on Bobo 89.1 FM. Cayman's #1 talk show is live weekdays from 7:30 a.m. Never miss an episode again. Watch anytime on CMR's Facebook and YouTube channels for the latest show episodes. Don't forget to follow us online on our social media channels. And visit CaymanMarlRoad.com for all the latest news and community happenings.